Ask if Melissa, if you can call the roll call.
Yes.
I'm just going to start to the right of me and just go down the table. Jay Giard.
Here.
Caitlin Parnell.
Here.
David Smith.
Here.
Megan Malcolm.
Here.
Aaron Pellegrini.
Here.
And also seated at the board table is Superintendent of Schools Bob Thompson and CFO Jeff Dowd. Thank you.
All right. Thank you, Melissa. Go ahead and stand for the pledge. You want to start us off?
Pledge allegiance
To the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, so before we get to the approval of the minutes, we just want to take a moment to recognize two members of our schools who have retired in the past but who had passed away over the summer. And just want to take a moment to recognize them for their service and what they've done for this town. The first person is a gentleman, George Stokinger, who had passed away this month. Born in Haverhill and graduated from Timberlane High School. Oops, sorry, wrong one. Sorry about that. Resident of Hsdsb since 1979, born in Boston, and he served for the school as treasurer, assistant treasurer for Timberlane and Hsdsb, where he continued on later on to be the business administrator at SAU 55. He did serve in this town from 1979 until 2017 when he retired. I'm just going to read a word from a friend of mine who had wrote something really nice about George, who knew George. Was a longtime resident of Hsdsb, spent 40 years here working for and with the community. He had many titles in Hsdsb, some official, such as the business administrator, some were just honorary, such as father, husband, grandfather, friend, surrogate dad, and role model. He was a resident who exemplified what we expect of a Hsdsb resident before, just for a long time. He'll be greatly missed, and I don't know if, Jeff, if you want to say a few kind words, since you did work with George for quite a long time.
Thank you, David. Yes, George was my immediate predecessor in my current role, and I worked with him for a number of years. He was a very dedicated to the district. No? Not working at all?
There you go.
Okay. Very dedicated to the district, as you said, for decades. He's a very good mentor, genuinely good human being. And I think that's something that is truly the staple of a good person. And I think the biggest compliment, I very much enjoyed his company always, and that was quite a thing to hear of his passing so early. Yeah. So he only retired a few years ago. So
yeah,
just shock.
Yeah, and we also rest in peace, and we appreciate his service. We appreciate everything he's done for this town in the past over many, many years. The next person that we want to speak to is, say, a young lady who had passed away earlier this year. Most knew her as Mrs. Wilson, who was a teacher here for many years, who retired in 2008. There's a lot of kind words that we've heard, and a lot of things a lot of people have passed on stories about her, and that's the number one thing I'd say that I've heard is there were so many stories from so many people in this community, past students, teachers, comrades of hers, that she was just always there to help the students. The number one story that I loved hearing was that she would be crocheting with the students, teach them crocheting, and that wasn't what she was here to do. I would just say she was here to be the teacher and mentor to the students, and that's what she was, and that's the lasting memory she provided to her friends, her daughter Melissa, and many others in this community. From when she was in school, where she graduated from Timberlane, she was always part of the community. She was in the Italian club, the Latin club, girls athletic club, member of the yearbook committee. And she was the committee that chose the burgundy and white that Timberlane now has for their school colors. Again, she went on to graduate from UNH in 1972, and then again she was at the Central School for just about 30 years, just over 30 years. So she spent the lifetime here, and I'm sure that if we polled many of the kids that have gone through the school system, they all have a story about her. So just want to give just a moment of silence for both Mrs. Wilson and George Stokinger. Thank you very much. Next on the agenda is we're going to go through the approval of minutes. So school board members, there are 9 sets of minutes in front of you. We have the June 8th workshop, regular and non-public meetings minutes. We have the July 6th workshop, special and non-public meeting minutes. And then we have the July 29th workshop, special and non-public meeting minutes. I'd like to take a few minutes to go through those, and then I'll be looking for a motion to approve.
I'll make the motion to approve all of the meeting minutes listed by the chair.
All right. We have a second?
I'll second that.
All right. Any discussion? All right. All approve, raise your hand. All right. Thank you.
Thank you.
All right. So we've got probably the most people we've had at one of the school board meetings since I've been here, and I'm sure for a while. And we want to just take a moment to discuss the policy so that all understand what's expected and how we're going to run this, as this is probably new for some people that are here that have not spoken before. And I know that you've been handed the policy. I'm going to just peruse some of this, the special, let's say some of the more pertinent pieces. As we all know, we're here to conduct the school board meeting to talk about policies, programs, operations. We do encourage and enjoy hearing from residents. Just opinion in here that it'd be great to see more people show up for these things, to see what we do and what we're talking about, to be involved, and we appreciate everyone here. All official meetings are open to the press and the public. However, the board does reserve the right to meet and adjourn or recess the meeting at any time. We also reserve the right to enter non-public session at any time, and that's in accordance with RSA 91-A:3. In order to assure that residents wish to speak, you've signed up. We want to make sure there's a few rules here. Time will be apportioned at the beginning right now for the public comments. This period may be extended by a majority vote of the board. Speakers are only limited to 3 minutes, so I will be keeping that time. Members of the public may offer comments on agenda items only. We will not be responding to questions or comments. So we'll hear, we'll listen, we'll definitely take this in consideration of anything anyone says, but we will not be responding to any comments at this time. Let's see. Consistent with RSA 91-A:3, policy BEDB, law pertaining to student and family privacy rights. The board will not place any matter on the public agenda that is properly discussed in a non-public session. Public comments are not for complaints about individual employees, personnel, or students. If there is any of those, we will be directing you to the superintendent to speak with Bob Thompson at another time. And that, again, is for privacy of personnel, students, etc. All speakers are to conduct themselves in a civil manner. Obscene, libellous, defamatory, or violent statements will be considered out of order and will not be tolerated. As the board chair, I do have the right to terminate the speaker's privileges if the speaker does not follow this rule of order. Be polite is all I ask. Don't want to shut anybody's speaking time down. Persons appearing before the board are reminded that members of the board are without authority to act independently as individuals in official matters. Thus, questions may be directed to individual board members, but answers, as I said, will not be responded to, as this will be for the public comments only. All right. So with that, we have a number of people that have signed up to speak. When you come up to the mic, please state your name and your address, and then you've got 3 minutes. Again, I will be keeping the time. And the first person to speak that I have on this list is Nicole Montmarquette. You do.
Hello? How do I work this thing? Do I need it? Okay. Hello?
There you go.
Okay. So I wrote something. I did send this via email before I came, just so that you would have everything that I'm going to say tonight with the links, with the data that I'm referencing. So you'll have that available to discuss and see. So, hi, my name is Nicole Montmarquette. I've lived in Hampstead for the past 8 years. I have a son who's currently a junior in college this year at Columbia in Chicago, and my daughter Olivia is entering 7th grade. I wanted to attend the school board meeting tonight to discuss the topic of mask mandates. I've sent what I'm going to read now via email. Yes, I already said that. So I'm here to advocate for allowing masks to be optional for the kids this year, and I'd like to present the data on why I believe this is the best choice moving forward. Before I start, I'd like to take the opportunity to thank you all for being in this position, volunteering, and having the best interests of the kids at heart. So first, I'd like to point out that prior mask studies that tested effectiveness were testing for the effectiveness of preventing large droplets from getting through, and this was back when we thought that that was the main driver of transmission. We've since learned that COVID is airborne, and there is science that shows that COVID is evolving or has evolved to being more airborne and being the primary driver of transmission. The results show that surgical and 3-ply masks, which see current widespread use, filter at apparent efficiencies of only 12.4% and 9.8% respectively, and I did link those articles to you. To sum up one of the studies in which volunteers wore masks that ranged from single-layer homemade cloth masks and progressed over the course of the study to double-layer commercially made cloth masks, double masks, surgical masks, and one KN95 mask. The reduction in airborne particles ranged from 3% with the least effective mask to 72% reduction with the K95 mask only. Scientists in these studies also suggest that the coronavirus is evolving or has evolved to being more efficiently spread through the air. To quote one of the scientists involved in the study, Lindsay Marr, said, "These results combined with epidemiological observations about the spread of Alpha and now Delta support the idea that these variants are supercharged when it comes to aerosol transmission." Another point I'd like to make regarding masks, specifically now that we know airborne transmission is occurring frequently, is that airborne particles can stay in the air for hours to days. This means that while kids may be masked in the classrooms and while the masks may prevent up to approximately 12% effectiveness against airborne particles when wearing them, as soon as they take their masks off in the cafeteria to eat as an entire grade or anywhere else, they're not protected at all. This means also when they're moving their masks around, anytime there's any part of their face that isn't covered, they're not protected. Keeping distance while seated or masking won't matter much when the airborne particles from talking or laughing linger in the air in the cafeteria, and then kids get up and walk through a cloud of airborne
Ms.
particles.
Marquette, 3 minutes is up.
Oh, no. I don't get any more time?
No.
Oh.
Thank
Wah,
you.
wah. Okay. Well, I did put everything in the email.
Thank you very much. All right. The next is Lori Elliott.
Hi, Lori Elliott, 15 Hastings Drive. Here to advocate also for the optional choice of masks. And then I do believe that there's very many people that have a wide range of how they feel about mask or no mask, and I like the fact that the parents are given an option. I asked my children before I came and said, "What would your choice be?" And they said, at this point, we really don't care. We just want to be in school. So I guess what I would point out is I think a lot of us are just looking for transparency and solid numbers this year. So if we are told we're going to wear masks, can you provide a number or a data point at which the parents can look at it and they say, yep, we're going to be wearing masks tomorrow. I don't think a lot of people have a problem with that. It's just knowing where that point is. That's it.
Thank you. All right. Thank you very much. The next is, I'm just going to say Erica. I don't want to mess up your last name, so thank you.
Hello, this is my first meeting. My name is Erica Shakimis. I live in East Hampstead. I am a nurse. I am also a mom of 3 under 12, 2 of which will be attending Hampstead Central this fall. And I am here to advocate that we follow the New Hampshire Department of Health and Human Services. They have a risk chart that's established for all school systems in New Hampshire to follow based on the community transmission. We are currently in substantial, which would be starting in universal mask mandate for all, which also is recommended by the American Academy of Pediatrics, which is our pediatricians where they take their medical advice. Dartmouth Hitchcock Children's Hospital of New Hampshire, the CDC, the United States Department of Health Education. I think it's really important. I have had 2 members, my mother and my aunt, come down with COVID in serious ICU cases where we almost said goodbye to my mom on a FaceTime with a nurse holding the FaceTime. Whereas my children don't have the option to be masked or to be vaccinated, and I am vaccinated. I think it's really important that we protect each other, and I'm not just saying this for my family, but to also protect your families, your children, for all, and to follow the guidance of our state epidemiologist and our state Department of Health. So in 6 months, if the rates come down and they say mask optional, I'm fine with that. I just want our school systems to be following our public health experts and guidance. That's all. Thank you.
Thank you. All right. The next is Kristen.
Hi, I'm Kristen Samoset, 156 Wash Pond Road. I'm here to be an advocate for if students want to wear masks, they should be able to wear masks. If they don't, they shouldn't. We started off with, 15 days to slow everything down. The kids went through all last year in the school system. Some kids had a lot of hard times with it. Some kids dealt with depression, anxiety, a lot of things that I don't think the school knows really what goes on back at home. But I'm here to advocate for, if you want to send your kid with masks, send them with masks. I think that we should have some classes like how it was said it was going to be. Some kids can go in with masks. Some kids don't need to wear a mask. It should be strictly with the parents. We should be able to say if our kids wear a mask or don't wear a mask. Not for you guys to say what you guys think, that you guys come up and say this is what we need, this is what we're going to do. And you're going to take X amount of people, percentage of people that want a mask and forget about the other people that don't want the mask. We were told that if we all get vaccinated, it's going to go away, everything's going to stop. So now we have 90 million to 100 million need to be vaccinated? What's going to happen when that 90 million gets vaccinated? Is the goalpost going to go further and further and further? You guys just had, we just had what? Summer school. Kids were here all summer long without masks, right? So now, time to go back to school, time to play politics is the way I like to say it. We're going to get into politics, and we're going to throw the dirty diapers back on our kids' faces. Oxygen is what kids need to breathe. Oxygen is what saves people's lives. Anyone that's an advocate for putting a dirty diaper on a kid's face, shame on them. Shame on them for breathing in carbon dioxide and taking all their bacteria and all their stuff back into their body. And shame on all you people if you guys say, we're going to start this new school year off with masks. Thank you very much.
Thank you. All right. Next, Jim Sweeney.
Sweetie, Wash Pond Road, Hampstead. Right before I came here tonight, thank you for letting me speak. I appreciate it. Hello, haven't seen you guys in a while. Right before I came here tonight, I wanted to grab an article from a local news source, WMUR. The key takeaways for that article were 5 more Grand Estaters died of COVID-19. What were the key takeaways? The most COVID-19 deaths announced in a single day since April 29th. The announcement came as effective cases rose to the highest level since May 1st. Current hospitalizations, highest level since April 21st. The fact that I do know is the CDC put out their guidance for COVID-19 prevention in K-12 schools. That's the Center for Disease Control. The top 3 takeaways. Students benefit from in-person learning. Tick. We all want that, right? Vaccination is a leading public health prevention strategy. Promoting vaccine can help schools return safely. Thank you for doing your drive the other day. The number 3 bullet point. I didn't take these out of order. This is the way they were listed. Due to the circulating and highly contagious Delta variant, CDC recommends universal indoor masking by all students aged 2 and older, staff, teachers, visitors to K-12 schools, regardless of vaccination status. So that's what I'm asking for tonight. So let's follow their guidance, just like we haven't for the in-person learning and promoting vaccination. Another fact I know is people like to use surrounding towns for guidance. What are my neighbors doing? Well, Timberlane School Board voted on Thursday the 19th to have masks. Derry has masks. If we look a little further to the south, the Mass Board of Elementary and Secondary Education is about to issue a statewide mask mandate. It's worse now than it was in June when we wore masks. There are a lot of social and political pressures about masks now. For me, and hopefully you, it comes down to science and respect of others. School boards across this country have a lot of responsibility. But I'm asking this school board to vote tonight to require masks. Some will say it's personal choice. My 2 children do not have a choice. There is no vaccine yet for my middle and central schoolers. Kids under 12 or kids and adults that can't get the vaccine, they don't have a choice. So when you talk about choice, think about them. Kids are resilient, and they did great last year with masks. Let us not teach our kids about giving up when the end is in sight. Vaccines for these kids will be here soon enough. Let us also not show our kids that what we went through was for a waste of time. You had to wear a mask last year, and now it's worse, and you don't have to wear a mask? What reasoning is that? So please vote to require masks. Just like you have in your handout, the matrix shows that we should be returning for masks. As far as I'm concerned, there's no question at that point. Thank you.
Thank you. All right, and I believe that concludes our public comments for today. All right, thank you. School board members? I'm sorry? I'm okay with one more. I'm okay with one more.
One more's fine.
Okay. All right. One more, if you. No. If you can just state your name and your address.
Sure. Hi, I'm Stephanie Wiggins. I live at 18 Shaker Lane in Hampstead, obviously. Thank you all for doing this. I know this is tough. I know that there's lots of people on both sides. But, you know, we talked a lot about last year when we wanted to come back to school or not come back to school, that we don't follow other towns, we don't follow what everybody else is doing, we do what's best for Hampstead. We sent out a survey recently about whether or not the kids should be masked. I think looking around the room, you know, it's not a mandate in the state of New Hampshire to wear a mask, and most people choose not to. Walking around stores, anywhere I go, the only where I have to wear a mask is when I go into my hospitals that I work at. And I'm perfectly fine with that. But to mandate that children 5 and up need to wear a mask all day long while they're learning, I think is not something that's acceptable when the rest of us are all doing what we need to do maskless. You know, it's not fair to ask them to bear the burden of this without everybody else doing it as well. And nobody feels the need to do it, or most people don't. So saying that while they sit in school for 8 hours a day trying to learn new concepts, my son has issues with speech, trying to learn how to speak correctly while people have masks on their face, I think is a disservice to them, and it's not fair. I know what the CDC says. I've read all of the information. I understand it's recommended by the pediatric, the APA. I get it. But we're a little town. We're not the entire United States. We know what's going on here. I think we have 100 cases right now in Hampstead, 117. Is it really worth making every single child in this town wear a mask? You brought up in the survey maybe there would be masked classrooms, and it sounded like that wasn't going to be happening, I'm assuming, without any more information, because there weren't enough children to fill those masked classrooms. Parents don't want their kids to have to wear masks all day. Mine came home complaining of headaches almost every day. So, we don't know what the long-term effect of kids wearing these all day long is going to be. We don't know how it's going to impact their lungs. And I know that they were having issues, health issues. None of them complained about having to do it, but they would complain to me that their heads hurt at the end of every single day. And I don't think it's fair to have them do it when clearly most of the rest of us aren't. If that changes, if there's mask guidelines for everywhere we go, then maybe we really look at it. But moving into school in the next 2 weeks, where my kids haven't worn masks at gymnastics, at karate, at dance, at camp, at daycare, all year last year at daycare, where these kids are all over each other. They had 2 cases. They didn't spread them maskless. Please just think about what this does to them and how any of us would have to feel sitting at a desk listening to somebody wearing a mask all day. Thank you.
Thank you. All right. So thank you all very much for your comments. We're going to jump right into current business, and we'll have our new superintendent, Mr. Thompson, present the school opening plan, which we'll, of course, have discussion on.
It should brighten up. Do I just do this? Take care of it. All right, good evening, everyone. This evening, the Hampstead School Administration will present the Hampstead Roadmap for a Safe Return to School. Now, this plan is actually a combination of plans. We submitted back in June a Safe Return to In-Person Learning plan to the Department of Education. That plan was approved. So you'll see in what we're about to present components of that plan. Also on August 11th, the Department of Health and Human Services released their school tools school toolkit for the 2021-2022 school year. And you'll see elements of that plan in what we're about to present. So to begin, on Tuesday, September 7th, 850 students and approximately 200 staff are going to walk through the front door of our Hampstead schools. It is the goal of this administrative team right here to ensure the safety, the health, and the well-being of those students by providing an on-site, in-person instructional model. And I want to really highlight that last part, an on-site instructional model. Because we take the position as a team, there is nothing that compares to children sitting in a classroom, interacting with their peers, being able to interact with their classroom teacher. We recognize the toll that remote learning can take on our children's mental health, on their ability to learn, and the burden that it creates for parents, and sometimes their mental health as well. We want children in school, and this plan is an attempt to create the continuity of operations that's needed for us to have 180 days of in-person instruction. And so what I'd like to do is just walk you through some of the measures that we're going to take. Many of these are similar to what you saw last year, so some of this is repetitive. One of the most important mitigation strategies when we talk about combating COVID-19 in schools is symptom monitoring. And I'm going to ask, because I have a captive audience, parents, please, if your child is sick, keep them at home. Call the school. Take them to a convenient MD, a Walmart, a Rite Aid, your pediatrician, to get a rapid. They can return to school relatively quickly. Last year, in the district I was in, I would oftentimes hear parents who had to come pick their student up who would say to me, they woke up with a cold, but I just thought it was a cold, or I just thought it was allergies. We can't take that chance. If we keep sick children out of our buildings, it's going to allow our students to learn in person and our teachers to teach in person. So that we'd ask, please do the daily symptom monitoring every single day, be in contact with the school. On our end, we're going to do the same thing. If your child is sent down to the nurse's office because they have any symptoms that could be COVID, we're going to call you and we're going to send them home. And you're either going to have them quarantined, which we hope you don't do, or we're going to ask you to have them to produce a negative COVID test. I'd also like to announce, too, that we will be working with the Convenient MD to be able to offer our parents the opportunity to do symptomatic PCR testing. We're still working out all of the details of this program, but it is an opportunity for us, to screen students as an optional program that parents would obviously opt into. So what I'll be doing later in the week is reaching out to parents to see what interest folks might have in participating in that program. Additionally, another mitigating strategy, which I think we're all familiar with at this point, is student quarantine and self-isolation. So any student or staff who tests positive for COVID-19 will be required to self-isolate for 10 days. That is similar to the protocols that were in place last year. You can't test out of the 10-day quarantine if you test positive. In addition, household siblings, non-vaccinated, of a student who tests positive for COVID-19 will be required to quarantine for 10 continuous days. And additionally, students and staff, and this is a change, students and staff who've been identified as a close contact to a COVID-19 positive individual, you'll be notified. So if your child comes into contact with someone who tests positive in the school environment, it's the obligation of the school, when we know, to notify you, but you will not be required to quarantine, and that's regardless of your vaccination status, whether you're vaccinated or not vaccinated. Now, we rely on the clinical judgment of our nurses. They're spectacular. We may recommend that you quarantine, but according to the Department of Health and Human Services, they would be the ones that would do any determination if quarantine were necessary. And now I'm going to turn it over to Nicole Tomaselli, who's going to talk about what instruction will look like this year.
So as Bob was saying earlier, we are so looking forward to, and I've been working with Dr. Cheney and Mrs. Donola very closely in the past few days, we're so looking forward to opening and having all the students come back on site in person for as many days as we can possibly get in this year. Having said that, if a student does test positive and has to quarantine for 10 days, we don't want to lose touch with those kids. So we have a commitment, and we've talked to membership and our administration already, that we are going to be providing schoolwork online, both schoolwork online and possibly via Zoom with tutors, to keep contact with these students daily. We're going to hire certified teachers and paras to provide remote tutoring and do progress check-ins during periods of quarantine or self-isolation. This will look approximately like a 10 or 20-minute Zoom in the morning. A para might Zoom into your home and help your student get all their work organized. We know that some of those executive functioning skills really fall apart when they do remote learning. So we're going to have like a morning check-in period where someone can help them walk through like a daily schedule, the assignments of the day, and help them get settled and prioritize their work. Later in the day, we're going to contact that child again with a certified teacher. That'll be a 30-minute Zoom. And this will be done by a teacher who's willing. We're going to give right of first refusal to your classroom teacher. But if that's not possible, we might reach out to a teacher that's in that grade level or someone else who is willing and able to do this outreach. The Hampstead School District is also partnering with the Virtual Learning Academy. You probably heard of VLAX. We've worked with them in the past to provide students with an option for online learning. Student enrollment is going to be available on a full or part-time basis through VLAX. That's the New Hampshire charter school for remote learning. It's been around for a long time, and it does have courses available K through 12. We're also going to be utilizing outdoor classroom spaces, and the staff are going to be highly encouraged to take their classes outside as frequently as possible this year, in addition to the mask breaks that they've been very accustomed to doing last year. In partnership with local community groups, we are hoping to build some additional outdoor learning spaces and kind of create them. And I can really see those outdoor learning spaces being utilized long past COVID. So if you are interested in helping build any of those outdoor classroom spaces, or if you work with a community group and you want to get involved, please reach out to me directly.
And briefly, I just want to talk about our facilities. And I also just want to give kudos to the custodial staff and all the work they've done, not only preparing the building for the start of the year, but ensuring the health and safety of our students as they enter into this facility. So to the greatest extent allowable, we're going to maintain a minimum of 3 feet of spacing within the educational facility. Literally, Mr. Mackey, our Buildings and Grounds Director, with our building principals, over the last week have been into every single classroom in the Hampstead schools, measuring desks, measuring spaces to ensure that we can have students that will, at a minimum, be seated 3 feet away from each other during classroom instruction. And that is achievable. One of the questions that a lot of middle school kids have been asking is, when do they get their lockers back? Well, they're getting their lockers back. We have decided that the use of the locker and the use of the cubby for their personal items is something that we're willing to allow them to have back. And I want to speak. I've been very impressed in the conversations that I've had with Mr. Mackey. He certainly knows his stuff when it comes to air quality, airflow. We do regular, and this was pre-COVID, regular air quality testing on a quarterly basis. During the pandemic, we've increased airflow. Airflow begins entering the building much sooner to the start of the school day, long after the day. So we keep continuous airflow. We also encourage teachers, when appropriate, to keep their windows open. Also, in terms of our facilities, we will be limiting the number of visitors to the building, trying to keep visitors to sort of essential visitors and volunteers as determined by the building principal. Also, we will begin allowing community groups, recreational programs to get into the building and utilize the buildings again after school hours. And now I'd like to take this opportunity to introduce for the first time our, no pressure, our Director of Student Services, Tracy Griffin-Hagen, who's going to talk about student services.
Thank you all for being here. I know it can be hard to get out, and hopefully you enjoyed some music before the rain came, and thank you for those who spoke. I know that takes a lot of courage. So first, each school will implement a developmentally appropriate action plan for addressing the social emotional needs of their students. The good news is that we already have some solid programs in place. At the middle school, there's an advisory program that's been ongoing and that will continue. And at the central school, they use a program called Second Step, which is delivered by the school counselor. But in addition to that, we are going to work with our community partners, such as Adventure Lore, who worked with us for our Summer Learning Academy. We're going to continue to use their services throughout the school year to bolster our SEL programming. And we'll also use our specialists, such as our school social worker, our school psychologist, to run little mini workshops, in advisory or in that second step program, so that we're bolstering those offerings and we're really taking a look at the whole child and all the needs that are associated with things like mask wearing, being back in the classroom, what is it to write back in our agenda, oh my gosh, I forgot my computer, to kind of reduce some of those anxieties and to reassure that it will be okay. We're all learning. That growth mindset. IEP 504 and parent-requested student progress meetings will continue to be held remotely. That's actually been somewhat popular, especially for working parents who can Zoom in and then Zoom out. So we're going to continue that. We're going to make sure that staff receive training in mental health first aid. This is a national program from the National Council for Mental Wellbeing, and it's a skills-based program. We're going to use a train-the-trainer model, so we will have a district trainer certified by November, and that individual will then begin to train the staff. The purpose of this training is to build the capacity of our staff to respond proactively to the social, emotional, and well-being of our students who are experiencing more anxiety and those sorts of things. Again, you can look that up on the internet and learn more about it. School staff will provide additional target support to students, especially those returning to in-person after a long time of remote learning. So what does that look like? Well, we're going to utilize the structures that we've already have. So we have something called RTI, which is response to instruction, and each school approaches that a little bit differently, but the crux of it is that a teacher identifies that a student might need a little more assistance in a skill. They come to a team to say, what can we do? What else can I do? Can I get some support with this? And then we create that support so that as students are progressing through their curriculum, we are adjusting and we are helping the teacher with resources to do that. Sometimes it's the resource of an extra person. Sometimes it's the resource of new materials. And that's where my department works so closely with Nicole's department to make sure that we have an eye on that and that we're using data to make sure that all of our students are progressing as they should. We'll continue to have homework club at the middle school level, and we're working to have transportation so that any student can access that and that transportation isn't a barrier. And then additionally, Nicole and I are going to continue to work with the building administrators, which we've started to do, to look at what else might we need. So as our students are coming back, how are we keeping an eye on this? How can we be proactive to say, what else can we offer after school? Right? What else can we do as a school community to make sure that our students are transitioning back into this full-time in-person model? Because to reiterate what Bob and Nicole said, that is our goal, right? 850 students back in the building 5 days a week, full days for the whole school year. That's what we all want. That's our common language. So we're here to make it happen. Thank you.
All right. So now let's talk about face coverings, which is, become a very popular subject. And I purposely saved it for the end of the presentation because I really want people to recognize there are a number of mitigation measures that we can put in place. We talked about symptom monitoring, social distancing. But the moment is now. Let's talk about face coverings. So the use of face coverings outdoors will be optional. Again, that's included in the guidelines from CDC and the Department of Health and Human Services. Per orders of the Centers for Disease Control, masks are required by both the driver and passengers on all public transportation. That includes school buses and vans. And what I am proposing tonight, I'm going to advise the Hampstead School Board to follow the Department of Health and Human Services decision-making matrix when determining the need for universal versus optional face coverings in the educational facility. And let me show you what that looks like. So essentially, Department of Health and Human Services, when they released their guidance on August 11th, created a matrix. This matrix at the top has level of community transmission, and they label that as minimal, moderate, and substantial. On the left-hand column, we see cases within the facility. There's sporadic cases with no evidence of facility transmission. Is a single cluster, and a cluster is defined as 3 or more cases that are interconnected. And then there are multiple clusters or a large outbreak. And you can see by the matrix, and I won't go through all of it, when a community is experiencing substantial spread, and that's defined by a geographical area. It's not the town of Hampstead. It's what's called the South Central Geographical Area. When there's substantial spread, Health and Human Services would recommend universal mask wearing across the environment indoors. As of right now, as of today, we are in that substantial category. And I just want to say, I stood up here on June 8th, and I very confidently recommended to this board that we go with optional masking. Now, I did that because I looked at data, and the data had indicated that on June 7th, there were 26 active cases in the state of New Hampshire. Today, I stand before this board, and I'm making a different recommendation. I've changed my mind. And part of that is because I've been looking at the data. And when I look at the cases from yesterday, there were 310 cases. So that's why I stand here. Because again, I want us to be operational. I want us to stay in school. So let me just walk you through the matrix, because somebody asked a really important question. They said, how do we know when we go from one model to the other? And I have an answer for you. So essentially the criteria, and this is from the Department of Health and Human Services, criteria for levels of community transmission. Again, we're in the substantial right now. So when we are in green, the new cases per 100,000 over 14 days, the average is 50 cases or less, and the percent positive rate is below 5%. That's green, we're good, no masks. Yellow, number of new cases per 100,000 over the 14 days is greater than 50, and the percent positivity rate is below 5%. And again, that could mean targeted mask use, or it could mean optional or universal. And then additionally, the substantial, the number of cases per 100,000 over the 14 days is 100 or greater, or the percent positivity rate is greater than 5%. So as of today, the data from the Department of Health and Human Services, we are currently in the substantial. We have 215.3 cases, the 14-day average out of 100,000. Our percent positivity rate is at 6.3%. So therefore, I am going to advise the board that they adopt this. And I understand this is a popular decision for people. And with all due respect, you didn't hire me as the superintendent to be popular. You hired me to ensure the safety, the well-being, and the health of the children in the school. And you hired me to keep this school operational and open. And I'm going to argue for a moment that if we start tight, if we adopt this matrix, there's room to loosen up. This is a standard, and people may not like the standard, but at least we can point to numbers, and you can hold this administration to task when our numbers begin to go down, because I do believe that they will. This is not about individual choice. It's about this collective community responsibility that we all take care of each other. I'm with you. I experienced, remote learning with my children while trying to also run a school system. It is not easy. And that's why me personally as a parent, I'm willing, if need be, to start the school year utilizing this matrix to be able to keep our schools open and operational, because we can always ease back. And at this time, our presentation is done, and I would welcome any comments or questions that board members might have.
So I'm sure there's a lot of questions and discussion, so I'll open it up to who wants to ask first or discuss any topics.
I have some questions.
All right, Caitlin.
For admin. So I want to focus for a minute on the instruction piece to make sure that I'm hearing it correctly. So if we have children who, first let me say, the additional online support, if we're talking about children who potentially are diagnosed with positive with COVID-19, and we know that quarantining, if you're a close contact, is not required. But if you have a family who chooses to quarantine their child if they've been exposed, they will get the online support as well, correct?
Yes.
Okay. And then we talked about 10 or 20 minutes in the morning with a paraeducator who can get them started, and then at the end of the day, like a 30-minute Zoom with a teacher on grade level. Are they going to have any ability to, like if they have a question during the day, emailing, what can they do there?
Let me just clarify, that's a really important distinction. The 30-minute potential Zoom that will be given by the certified teacher, it may not be at the end of the day. It's going to be at a mutually agreeable time, and we are going to need to coordinate that with teachers and their contractual time and find places during the day so that kids don't go 6-8 hours with no instruction.
Okay, great.
So we'll coordinate mutually agreeable times. And I also wanted to mention that the resources online are going to be maintained by the grade levels in their Google Classrooms or on Seesaw so that we're ready.
Okay.
If the child becomes a positive test case, our materials are there. We're not trying to play catch up. We're not photocopying like crazy, trying to create packets. Our materials are going to be posted online from day one.
Okay, thank you.
Follow up on that one with the morning calls, afternoon calls. Is that going to be one-on-one, or if there's multiple students in that classroom, is it going to be trying to coordinate that?
You want to answer that? Yeah.
There definitely could be an opportunity for us to do some small group instruction. Again, you'd have to have consent from the parents because potentially there could be some privacy issues. Right. But I know a number of parents that may actually welcome the opportunity for some small group instruction over Zoom.
Okay, thank you.
I have one more about instruction. So we talked about, you mentioned the VLAX opportunity, and I know you mentioned there's an option for full-time or part-time. Is that available if we're talking about a 10-day absence, or is that more like an extended? Okay.
No, VLAX, think of them as courses.
Right.
It's really an online course, and you would subscribe for the entire year or semester based on the content.
Oh, sorry.
I don't know if we're, go ahead. I didn't hear the question, I'm sorry.
There's not supposed to be any public interaction.
Oh, no.
Just, I appreciate the input, but at this point, the public interaction with the discussion, it was for the public comments, but thank you.
Thank you.
All right. Other, 'cause I know I have a few, but.
Yeah, no,
Yeah, I got a couple. I'm going to start off with the chart. I know that's where the popularity.
Jason, you want to speak in the mic?
I know the chart's where the popularity is. That's the one. Right off the bat, it says sporadic cases without evidence of facility transmission. Okay, we're starting off the school year. We have zero transmission. We have nothing inside of the school.
Jason, just speak up in the mic.
Is being transmitted. So it jumps from optional to universal, and I understand that's because of our geography. But we have no transmission in town. We have, I think it was this morning, 17 active cases in Hampstead. Why does it go to universal at that point and not targeted or optional when we don't have any transmission? Our kids aren't going to be spreading this if they don't have it. If the school's not open, why do we start there?
And to be honest with you, Jay, I'm not sure that I can completely answer that because this was developed by the Department of Health and Human Services. I know they did coordinate with the Centers of Disease Control. So where they arrived at the, less than 50 cases is minimal, 50 to 100 is moderate. I don't know what went into that design. I think, part of the recommendation on the administration's part is it is a standard that's being offered by health professionals. And as of right now, it's the only standard that we have. And I know that some people find it frustrating. And I understand the argument where it would be nice if that community transmission was based solely on the Hampstead community. It's not. The Department of Health and Human Services looks at it by county or by region. And the reason they do that, I don't entirely know, to be honest.
And let me clarify. Student safety is going to be my most paramount focus through this year. And I've got 4 kids in the schools. One being in kindergarten, can't get vaccinated, can't go through doesn't have the choices that we have as adults. So I have concerns with the spread. I do. But I also feel like we've all said that we can pivot, we can transition, we can go one way or the other if the numbers change. So I also believe that we could start off with a mask optional program and transition if we start seeing transmission in our schools. And if we don't see that transmission in our schools, then we don't need to pivot. But to start off here, we can't, the only other option from here is we shut down our schools. If we wear masks and it's spreading and we're getting cases, the next step is we go remote or we go hybrid and we shut down. Possibly, and I don't know, I'm not an expert. I think I am because I've read about 100,000 articles in the last week.
Haven't we all?
But I'm not an expert and I'm not going to pretend to be. But if we start off wearing masks, there's the only place to go from there if we have community spread or if we have school spread is to shut down our schools. And I know nobody wants that. I feel if we start off possibly with a mask optional option there and we start seeing some spread, then we add masks to the equation, we make it mandatory at that point, and we see if it slows down the transmission. Just my opinion.
So I definitely want to come back to the mask discussion. I think we all do. We're going to talk about that a bit. I would ask Jason if we can talk about everything but for right now, just because it's going to get into some good discussion, I think, and I think we should answer some of the easier stuff and lead up to it, kind of, like the appetizer of this, of sorts. So
I like dessert first.
Yeah, I appreciate the easy ones first.
So I'd like just about the outdoor classrooms. Can you speak a little bit more about what we're either offering, about what we're suggesting for the teachers, and then also I'd like if you could speak a little bit more about I know it's another topic for later, but kind of your vision of what we're looking for in the future that we can adapt now versus what could be there in the coming months, because I think that's going to be an important aspect of all this.
So in full disclosure, I was an environmental science teacher at one point in my 20 years here, so I feel very passionately about getting students outside to experience nature, regardless of COVID and masks. But for outdoor classroom space, the need for additional mask breaks in the student's day, it's very prevalent. So why not establish those spaces? And it's a pretty straightforward process of taking an aerial view of the school campus and property and identifying areas. And it's ideal really to have a tent, although as Erin was educating me this afternoon, there's a wind tunnel apparently that forms in the middle of this parking lot here. So the front of this middle school would not be a good place to put a tent, from what I'm hearing. But those outdoor spaces, they don't necessarily have to be walled, and they don't even have to have seating. Kids can bring beach towels, yoga mats, little buckets to sit on, and a lot of instructional materials. There's plenty of ways that we can get very creative and bring instructional materials outside. So I would work very closely, and we've already had some preliminary discussions with administration, but I would work very closely with the administrative teams to identify locations that it would be ideal and then build that into every child's schedule. Yep. So that they're consistently experiencing those spaces. And some of those might be temporary this year for COVID reasons, but in the long term, establishing little pockets of land along maybe your cross-country trail is an area that we've thought about because the trail system already exists, and carving out little spaces where you can put tree stumps and other fun type little benches can really enable your teachers to bring them outside and have some really creative lessons, and specialists as well.
Okay. And I know it's something that Megan's passionate about, and we've talked a number of times here, so it'd be great to see what that looks like. And then you had suggested that community involvement. I think that'd be I think there's a lot of people out there that would help with whatever the vision is, and as well as the input. So
yeah,
thank you.
And I would just frame it by saying we can't do it if the kids aren't here. We need them in school to be able to pull these things off. And we have talked to a few community members already who are interested, and we could welcome a lot more support with that too.
Okay. Erin or Megan, do you have anything yet?
Not based on
I have a comment.
Oh, please.
Okay. I don't know if this is on. Okay. So I was really hoping I wouldn't have to be here for a second year talking about COVID. That was very wishful thinking, I guess. And I have to say, I appreciate how safe Hampstead played it last year, although it broke my heart to see how, I'm not going to start crying, how emotionally and socially distressed our children turned out being. The emails that we would receive from you parents, I would cry. Like, I cried more tears last year than I've ever cried in my life. And it was for all of your kids. Like, my kids were fine. I really appreciate the fact that we're getting our kids back to school full time. They don't need to be in front of screens, partly remote, or part of the time or full time. So I really appreciate this. I appreciate all the effort that Mrs. Denala and Dr. Cheney and all of the administration is putting forth to get our kids set up for safe classroom environments. And Mr. Thompson, I really appreciate the plan that you've put forth. That's all I'm going to say for now, because I know we're going to talk about masks a little bit later. But thank you, everyone. I'm really excited to have our kids back in school full time on September 7th.
Yep.
Thanks.
So I'm going to ask a question about the PCR testing. Can you give a little bit more information about that? Because I think that is going to be vital no matter what plan, no matter what we decide tonight. And I think that that's worth speaking a little bit more to and what we're looking for. I know it's optional for parents and to enroll their children, but just can you, a little bit more detail behind that, how that would work, Mr. Thompson?
Yeah, so the state of New Hampshire received a $40 million grant from the federal government that allows for symptomatic testing of residents. And a portion of that money has gone to school districts. And so Convenient MD offers a service. They're one of the more local providers where they will come in on a regular basis. It could be once a week. It could be every 2 weeks. It could be every month. We could determine the frequency. They would come in at a time that's convenient for students. It could be lunch. It could be the very start of the school day. Might be advisory. Might be the very end of the school day. They would just need a space within the facility. And we would have students come down. They'd quickly be swabbed. And those parents would sign up through the portal. They'd receive their results within no later than 48 hours. And the school would also receive the results as well. In order to participate in the program, we'd need a commitment to have at least 25% of our families who would participate in the program. Again, the program is completely optional. There's some additional benefit to signing up for the routine screenings. If we were to have a cluster within a classroom, Convenient MD would come on site and could, if parents agreed, they could test students that day. Or on another day, so that you'd have, as a parent, definitive answers about positivity or negativity. So it's something we're certainly exploring. I can tell you one of the barriers that we're talking about as an administrative team is staffing. It involves staffing on our part to be able to help support this program. A district of this size, staffing is limited, but there are opportunities for us to potentially use what we call ESSER funds. That's the federal funds that were given to us for COVID relief. So we're exploring it. It's a program that we're definitely interested in bringing in, and we'd really like to make it happen.
I just have a clarifying question, because I think I saw, is the testing that is optional for symptomatic or asymptomatic?
I'm sorry, asymptomatic.
Okay,
Asymptomatic individuals.
Okay, perfect.
They will not test symptomatic individuals simply because we don't want symptomatic individuals in our building.
Thank you.
Got it. Okay.
I just have a comment on that since we're talking about it. I think this is a really good kind of extra layer of protection, especially because as we're going through this, we don't know all the time when kids maybe not showing symptoms but I feel like this is another layer of protection for everyone because we're catching potentially cases early. So I think it's great. Thank you for looking into it.
All right. Next question I have is about the close contact. Last year it was the person who had COVID, positive case, and then close contact also had to quarantine, and then I think you would notify everybody in the classroom essentially. Mm-hmm. Now it's not that stringent; it's a little bit looser. Are we contemplating or have we discussed more about notifying everybody in the classroom?
Yet to the greatest extent so we are obligated under the guidance that's been provided by Health and Human Services and the Department of Education that we have to notify when we are aware of a close contact. I would add in there if there's even a suspicion, which typically would include all of the students in a classroom. But it's difficult for me to say definitively that if there were a case in a classroom that we would notify everyone. It is case specific. I can tell you that is the intention, but there could be a single circumstance where one child has to self-isolate, and there are some privacy concerns about that. I don't anticipate that would be the case. So I'd like to tell you, David, that yes, it is our intention to notify entire classrooms, but that would be under knowing that we were not violating the individual privacy rights of a student.
Right, I understand, because if you have one student that's not there the next day, everybody knows that Johnny or Sally was the one. So I get the privacy issue. So that
and oftentimes, because this has been an experience I've had. If I were to ask a parent of a child who's positive, do you mind if I tell the other children, the parents of the children in the classroom, that there was a case? I'm not even going to say it was your child. I have not run into a circumstance where I've had a parent say no. Okay. But sometimes it does come down to that. If there are multiple children out, it becomes a lot easier. It's less identifiable.
So I was going to ask, are you going to ask the parent to and give that parent the choice of, that way they know it's Johnny or Sally was out?
We can certainly do that. And again, the standard of identifying someone as a close contact, we can, make assumptions that several kids in that classroom, and that may lend itself to notification to every parent in that classroom.
Okay. Got a couple more questions before talk about mask again, but I know that's the dying thing. But when we talk about homework club, I just want to ask a question about the homework club for everybody. Homework club, is that only after school? Is it before school? How are we doing that? Sorry.
So I believe traditionally homework club has been after school. However, and you'll see in the presentation about ESSER funds in a little while that we can expand our offerings because of the ESSER grants that we're going to be eligible to receive. So one of the things that I would like to accomplish is kind of targeting homework club a little bit more, and also incorporating more enrichment opportunities, so that maybe we have an English language arts homework section or work space, and then we might have a math room with math games, math talk, math interactives. It might not be just doing the homework. It might be enriching your math familiarity and comfort.
I know I speak for myself and my kids, a lot of other people that said, we know remote, we lost some learning.
Yep.
So anything we can do, that's appreciated. If it's before, after, very targeted. That's awesome. Great.
Yeah, and I think what we'll be doing once we get rolling with the staff here is working closely with our staff to identify students' needs, and of course talking with the students directly about what they would like to see for after-school programming. And honestly, there's not a lot of reason we couldn't do things before school as well, especially with the later start at the central school.
Okay. Two more questions around this. Sorry. Before last year, we had the daycare before and after. We are returning to that, correct?
Yes.
Okay. And then we also had enrichment classes that were offered after school. Is that something we are going to start back up?
I'm going to yield to the principals because I'm not familiar with what was offered in the past.
That was PTSA.
Okay.
Okay, so that's to be determined. Okay.
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 Yeah, and like I said before, we have a lot of room within ESSER to create programs, and to create programs with, even in conjunction with the PTSA, to make things happen.
Okay, thank you. All right. Anything else before we get into discussion of mask?
All my questions are about that.
Okay. All right, we'll get into mask, everybody. That's what we're going to do now. Who wants to start? I know, Jason, you started it before, but if anybody...
Well, can I just kind of go off of what Jason was saying? So where I mean, I've read so many different things on both sides of the fence here, and I totally get all these sides, and it's really been very difficult. But I think it's hard because Rockingham County is huge. So when you look at the numbers, the numbers are high because Rockingham County is huge. But Hampstead is such a small piece of that. I do struggle a little bit with the different numbers because I know like kids have been in, in camps, and they've been playing sports and all these things all summer with no masks. And so I do struggle with it, but I also do understand that it's not necessarily, this is going to be hard for me to explain, but I think sometimes it's not necessarily full parent choice when there's some parents that really don't have a choice because they want their kids to be vaccinated and they can't. So they don't really have that choice until the kids can be vaccinated, and then it's full parent choice. But I'm so this is just such a hard thing because I do look at like what Jay was saying, and I do wonder why we can't go by what Hampstead numbers are. So I think
No, thank you though. Thank you very much. All right, I have questions before any commentary. I just wanted some clarifying questions, Mr. Thompson. Air quality, airflow has been one that's been a big topic, right? In the middle school, we've always had a very good airflow, air quality. We've done very well with the test. Last year, I think we did once every 3 months is what we were doing testing, past flying colors, essentially. There was questions about Central School as there's the renovations, there's all this stuff going on there. Can you talk to the air quality tests that we've received and anything with the update? It kind of goes into later on, but anything with the update of the air quality we'll have at the opening with the renovations. Is there a concern there, just in general?
Well, it really breaks down to there's two components to it. There's the air quality, and we have regular air quality tests done, and that really measures the quality of the air in the building in comparison to the quality of the air outside of the building. And when we look at those reports, and I have had an opportunity to review those reports, we come back consistently over time as having air quality that meets or exceeds the standard for what it should. So there's no concerns in that regard. When it comes to ventilation, again, we have an air ventilation system that our director of buildings and grounds oversees. And that really ensures consistency of air quality. We consistently pump in fresh air. Existing air in the building is pumped out. And so, oftentimes people ask about, well, what about adding, HEPA filters to a classroom environment? Well, with a central air ventilation system, we have one individual who's highly trained in HVAC who's able to monitor and maintain that system. And we replace the filters on a regular basis. We use, high-grade filters to ensure that the air quality meets or exceeds the standard.
All right. No, thank you. I'll just speak a little bit about this past, I think it was this past Friday, I spent 2 hours in the building with Mr. Mackey, who is the director of facilities, walking every inch of the middle school, going into the pump room, going into the locker room. It's actually clean now. The kids will like it, but it was good to see that the ventilation was up. Mr. Mackey, I don't know if you want to say anything, but it was just a matter of, the pride that he's putting into the work, the checking that he's doing that was or was not happening before, as well as, I don't think it was, accolades to you of how well you're maintaining everything. So it's appreciated there. I know I have full confidence, not only you, Mr. Thompson, but Mr. Mackey, of how much he's putting into this school system that is getting us just past what we've done in years ago. So I appreciate that. The work that you and your crew are doing is superlative. Thank you.
We're on masks, so I'll go with it. I think, to me, I want to speak a little bit to what both Aaron and Jay mentioned about what numbers we're looking at, where we're looking. And while I think in some respects it makes sense to look at just Hampstead numbers, on the other hand, I don't think there's very many of us who don't leave the town, whether it's going to work, whether it's being in various activities that you're interacting with other people. I do think it makes sense to look at the general area and the numbers there. And frankly, I haven't done the math, so I don't even know if our numbers in Hampstead, when you do the ratio over 100,000 versus 8,000, which I think is our population right now, I think we're actually higher than 100 per 100,000. I'm not sure, but to me, the reason I'm happy to see this recommendation, but also to have the discussion, is that my highest priority, taking out what everyone else said of, yes, we want to keep everyone healthy, of course, is keeping them in school. The last thing I want to see happen is to have to move to a remote situation. I think the situation last year was not education how anyone wanted to see it. I don't think it was how educators wanted to do it. It was still, even though we were a year into it, it was still emergency learning. It was not learning and education as we want to see it. So for me, anything that keeps us in person and having those kids in front of teachers is worth it. That's it.
I'm good right now. And another clarify, I want to make sure I heard you correctly, Mrs. Thompson, and I think it's worth reiterating, was the principals, Mr. Mackey, yourself, have gone through and have measured within the students in the classroom, we can maintain 3 feet or more for each of the children, correct?
Correct. Now, that's not to say, Hampstead's a very desirable community and people want to move here. If we could have a situation arise where our class sizes go up, and that may not be the case, that's just the reality of the situation. And if that were to happen, we would communicate to families of a classroom to say it's difficult for us to maintain the 3 feet of distancing. There are other protective measures that we can put in place, including protective barriers such as plexiglass. Now, the CDC has said that they are not necessarily an effective mitigation strategy, but it is a strategy. So right now we can do 3 feet. That is not a problem. It's tight. Not all the furniture is going back into the classroom, but we are able at this point in time to be able to achieve that.
If a parent wanted their student to have that plexiglass, is that something that would be considered optional for those parents?
Yeah, I would ask that if that is the case, to have the parent reach out to the building administrator. It's certainly something that we could do, but again, we have to keep in mind that we've learned a lot over the last year, a tremendous amount. We've learned that masks are a protective measure in mitigating illness within a school. There's lots of data to support that. There's lots of peer-reviewed studies that indicate that. But we've also learned that surface contact with COVID it's not as transmissible as we believe. And we've also learned that protective barriers such as shields, plexiglass, does not offer the same level of protection as other mitigating factors might. So we can certainly do that. I wouldn't want parents to think that is an appropriate measure of protection, because it may not give them the protection they're looking for.
Okay.
But that in combination with some of the other measures being put in place isn't going to hurt. Could have some benefit.
I would agree with that, as long as there's not false confidence. But yeah, I would agree with you, Aaron.
Okay.
One of the things we covered earlier that was on the chart was that it was the average over 14 days. So is that something that we're looking at daily? Is that something that we're looking at the night before? Because over 14 days it could change, and one day we could be in the targeted section. We could be in the moderate transmission, and then the following day we can be in substantial. How are we going to look at that on a regular basis? Obviously, we're not going to look every 14 days. That could change daily. So how are we going to look at that?
Yeah, so I can tell you, I look at the data constantly. I have it up in my office on a screen. I'm monitoring it all the time. I have dreams about the data, nightmares. And I've thought a lot about this. If we move from there is the possibility we could go in and out of this model on a regular basis. And how I would approach that is I would notify the building principals that we have moved from substantial to moderate. Masks are optional, And that information would be conveyed to students, and it would also go out into announcement with parents to make them aware. You know, that could result in us moving in and out of a model, several times in a week or every other day. I'm comfortable with that because I would prefer that to being stuck wearing masks all the time. I'm really confident that we're going to be able to move out of that substantial. And so I'm willing to take on that burden of, okay, principals, today we're optional. Tomorrow, the next day we may be back to universal.
How do we communicate that with the parents? If we're looking at it at 5 o'clock in the morning, some parents aren't up that early. Some parents need time to plan and get prepared, get their kids prepared. How do we communicate that out to the parents so that they know?
Yeah, and I think we're still working on developing that because honestly, I want to see what direction the board takes with this. But I would see that as something a decision would be made the day before, to give parents the opportunity to make whatever adjustment they felt like they needed to make.
Do you think it's worse to go continuously back and forth than to just, I don't know.
No, I share some of the concerns that some of our speakers have shared. If we develop this standard, there will be times where people who want masks all the time are going to be upset because this allows us to move in and out. And then there's other times where we're going to be masked. I like this because it doesn't keep us in one mode all the time. We'll move in and out. There should be fluidity to it. So I'm comfortable with us having to make the decision. And of course, the board could decide otherwise, making the decision that this is a fluid thing. Parents would be notified every time a change was made. We'd give them some advance notice. We'd notify building administration.
Comments? Anybody else right yet? Questions? Because I got a couple more here.
No, I do worry that would be confusing, especially to some of the younger students. So that's just a comment.
Yeah. I think for me right now, there's a part that we have not talked about openly in public yet, which is the survey that we sent out. I think it's worth noting so that it puts fact from fiction about what was out there, what the responses were. If you're okay with me speaking to it a little bit, or would you rather speak
please,
to it, Mr.
absolutely.
Johnson?
Yep.
We did get about somewhere 200 or so parents had responded. It was about 60%, a little bit more than 60%, that wanted this to be optional. We got about 40% that were either they wanted it required or they still needed time to think about it and discuss. Me personally, I would never want to say, well, in majority rules. I think we've seen that divide the country. I think that it's always, you don't just take into one account and don't take into account what anybody else is thinking. I think that's the wrong way to do this. I think that there is a middle ground here. I know some of us have talked about it a little bit or have seen it in other communities. So if I want to talk about what could be a middle ground right now, if that's all right with everybody. We know the buses are mandated, so that will happen. Doesn't matter what we say here, nothing. Kids are going to wear a mask on the bus. We also all agree, I believe, mask outside is optional. That's something we've already said. That's something that, it's great to hear that there's going to be options there. We're going to be putting a lot more emphasis on that, not only now, but in the future for Hampstead. And I think that's a great learning model, something Megan ran on and has talked about for years. I think we can all agree we do want our children in here full time. As a parent, as a school board member, I never wanted remote. I thought it was just not a great model for our kids. Even hybrid was difficult for especially our teachers. So being in school full time needs to be happening. So that's the middle ground. For me, it's, we've got a number of things under our belt that we're going to be able to use this year when it comes to PCR testing, which I think that's going to help us. Whether or not you want your child tested or not, my opinion is that's a big emphasis here for us to monitor and to make sure that it's not going to be an outbreak. We can keep our kids 3 feet apart. We've heard that. We also have the air quality, that is being tested, and it's better than it's ever been. I remember when I got here, hearing about these in Central School how bad it was. And again, thanks Mr. Mackey coming in there and saving the day with his team. That was awesome. I do feel that in the hallways, when we don't know who the kids are touching, we don't know, how packed they can be in the hallways. So we know that in the hallways, this would be transferred a lot faster than if they're sitting at their desk. I think we can all agree to that. Hopefully we can. I'm not saying how severe it is. I'm not saying if it's targeted for kids, but it does, when you put more people in a room together, tight, or in a hallway, this can transmit. That's, I guess, more my opinion than, some people argue that it's not. But I do think that when our kids are in a classroom seated at their desk, when they are 3 feet apart, that is when we can lean towards being a bit more optional with a mask. So, that's where I would suggest we go towards is, again, optional in the classroom when they're seated at their desk. I do think in the hallways, have them wear their mask. Any place that's in an area that we can't keep them 3 feet apart, that has a mask. I think that meets a middle ground for everybody. Again, maybe I learned through just past relationships. You can walk away and everybody doesn't feel like they won. Well, that's a win. So that's what my suggestion would be. I'm not asking to make a motion yet. I'd like to talk a bit more about where everybody is. We can certainly make a motion and then discuss, but that's my thoughts.
I have some questions. Surprise. I do agree with you that in the hallway, I think that especially at the middle school where lockers are going to be put back into play, where that's sort of where everybody congregates, that it would be a wise choice to keep the masks on. I guess I would ask the questions to the administrators or Bob. Do we feel that we can safely remove the masks while they're seated at their desks? Do we feel that the air quality and the barriers and all the other things we've put into place would keep them, that we could safely do that?
I would say that it is a compromise. I think that it does provide the opportunity to see how the opening of school will go. If you look at the guidance, I think more specifically to answer your question, the guidance says to maintain ideally 3 feet, if not more, of space. I do think provides a layer of protection. If we were less than 3 feet, I would be uncomfortable with that recommendation. And I think if we can maintain that 3 feet of spacing within the classroom, students take off their masks, I would be comfortable supporting that. I guess where I would become uncomfortable is if we look at the matrix, we're talking right now about community transmission because school, to Jay's point, school hasn't started. Right. If school starts and we look at the left-hand column of the matrix where it says that we move down to that second rectangle that says a cluster or multiple clusters, then I would suggest, whether it's the board or that discretion is given to the superintendent, that we reevaluate that position. So we could start school potentially with the 3 feet of spacing, but if cases using the matrix were to emerge, that would be when I think we need to reevaluate that position.
So if we were to go that route, I would imagine there would be some scenarios where we want the students to put their masks on, like if they're doing a lab or something like that, or like a group activity where they are definitely closer, right? Because they're doing something together. Would you agree with that, or?
I would. So if you adopted a model where students seated, spaced at 3 feet within a classroom would take their mask off, what the administrative team would do is we would develop guidelines for teachers, what specifically that would look like, to include, small group instruction with the classroom teacher with the student, individual instruction, small group instruction, labs. We would clearly define for our educators what that would look like within a classroom. And I think, David spoke to many of those things. This is really when you're in your seat, seated in space 3 feet. All other circumstances would require a mask.
Could I just add to this for 1 minute regarding instruction? One of the biggest values of having everyone back fully in on site is for us to be able to grow the children academically a year's growth in a year's time and give them the skills they need. And some of the best practice to do that is small group instruction in a workshop setting where they work in small cooperative groups or they do partner pair share type things. Before COVID, they would sit on the rug and gather for like a morning meeting in younger grades. Some of those things we won't be able to do. I just want to be really clear with our teachers. We probably won't gather for morning meeting. They'll sit at their desks. But I would love to be able to have our teachers do the amazing best practice that they know how to do, maybe with the children wearing their masks so they can be close. So when they are at their desks doing independent work, it sounds like maybe 3 feet apart, masks could be off, but I just want the board to know that some of the best, most profound instructional techniques require targeted instruction to specific groups so that you can differentiate your reading groups and you can differentiate your math skill instruction. And, with COVID, teaching practices kind of stepped back last year because we had to keep everybody kind of spread out and a lecture up front and keep away. But if we can move that forward this year, utilizing face masks as a mitigating strategy, I think you would see a lot of productive growth in your students.
And do you think that the staff, which maybe the principals you think the staff could handle that back and forth? So if someone was at their desk, take their mask off, hey, we're going into a lab, you might want to put that back on.
Yeah, and I can speak to that as well. This plan that you see here, there was a lot of discussions with a lot of folks within the schools, including the building administrators and the association, the impact that this would have on teachers. And I think, first and foremost, they have the mindset, whatever it takes to get back to in-person instruction, our teachers are on board with. They really want to be here. They don't want to be in their homes teaching remotely. I think that the conversations that I've had, teachers can get concerned when they have to wear a face mask to provide direct instruction, and the kid in the back of the classroom is having a difficult time hearing them. So to David's point, adopting a model where 3 feet of spacing would allow the teacher to take the mask off. Because when we talk about universal masking, we're not just talking about kids, we're talking about teachers as well, vaccinated or unvaccinated, So I think teachers would be open to the idea of there are opportunities for them to take the mask off to provide direct instruction, but they're going to have to put the mask back on occasion when it comes to the delivery of small group or individualized instruction.
I have an additional question. Would we be moving, if we were to do something like this, would we be considering keeping cohorts kind of like we did before, so that we're sort of keeping the students moving together in groups?
I think that's more of a building specific thing. I don't know if the
Central school is a lot easier to cohort students than with their group. They go to PE with their same class and things like that.
Sorry. Would you mind speaking on the mic just that way people at home can hear? Thank you. Dr. Cheney, appreciate it.
Sorry about that. My apologies. At Central School, it's fairly easy to cohort students. They have a primary classroom teacher. They travel to Unified Arts and things of that nature. There are times for additional services, Title I, things like that, where they might be with students from other classrooms. But in general, we try to keep the students together as much as possible.
Hello, everyone. At the middle school, we move by grade levels, and we try to stagger release time with the other grade levels to keep the corridors at a minimal amount of people in them. And also, we do the one-way corridors that we are going to continue doing that we did last year. Regardless of COVID, it was good because our hallways are small, and then there's going to be locker activity. So we're going to continue to maintain many of these practices that are just good overall for our kids.
Yeah, that's something that last week, when I can tell you every board member's been talking about this and reading on this probably more than their full-time job. for myself, I did a test for myself. Is last week I wore a mask for 3 days at work, but I'm at home. I work remote. I was doing remote before. I wore a mask for 3 days. I'll tell you that I would never want to do that again 3 days in a row. And I was thankful that I did take my mask breaks, and it just taught me, like, I'm doing work, and most of the time I'm not on screen with everybody. They'd be like, why do you have a mask in your basement by yourself? It's kind of strange, but, but I wore the mask just to see what it would be like for the kids 3 days in a row. And I attempted to keep it on almost the entire time. There were times I did take a break from it. I will tell you that I did not work as effectively as I typically would without the mask. And that, it was a lesson for me there. I'll also tell a story that a couple weeks ago I was in Vermont. It's mask optional. It was great to go into some of the supermarkets. Everybody was wearing masks. They had that, but it was an optional for them. It wasn't mandated. It was community help. And I think that what we would see here, in my opinion, we would see kids wearing masks. I think that we would still see, I don't say more often than not, but we'd still see kids wearing masks because it's optional. It's available to them. So that's where I tend to go to with this. Is I hope that more would use it, but I don't feel comfortable saying yes, you're mandated. If it was mandated for me, I would see this on the grid saying mandated, not recommended. So that's where I'm at with this right now for myself. But
I just want to clarify. You mean at their desks, still? What you just said. I'm sorry. Where
Yep.
you're saying optional versus mandated. You're talking about sitting at their desk.
At the desk, yeah.
Just. Thank you.
I've bounced back and forth for multiple weeks on this. You read one article that says one thing, you read another article that says something different. You don't know what to think about it. Everybody's an expert. Everybody's a doctor. It's tough to make a decision, but I think I've already made it clear that I'm leaning towards a mask optional or a no mask mandate, however we want to word it. Just my opinion. I've read all the emails that all of our parents have sent us. Some have been very respectful, some maybe not as much, but I've read them all, and I appreciate them all, and I appreciate everybody who came here tonight and spoke, because it is difficult, and this is a very tumultuous situation. And it seems like Dave said earlier, we are split down the middle by a wedge, and not just by a couple of varying opinions. It's either yes or no, and there is no middle ground. I have also watched, it's got to be 7, possibly 8 school board meetings from area towns, New Hampshire towns from the last week. And I've seen everything from making masks mandated to optional to hybrid situations, kind of like what we're discussing right now. I believe it was Pelham who is adopting a similar hybrid situation. My fear here comes with what we heard one of our speakers say earlier, and when they said, oh, my kid woke up with just a cold, or it's just allergies. I'm one of those people that suffers from allergies year round. I wake up every day with a headache, with sniffles, with congestion. If we adopt anything that is hybrid or anything that is optional, we've got to take responsibility and ownership as parents to not send our kids to school with the sniffles. We have to take that responsibility. That's what we need to do, because if we want to stay in school this year, we have no choice. And if we go down this road and we have a cluster and we end up going mask mandate, the next step is remote. And I can't go through another year of remote learning, not with 4 kids. It's just not something that can happen. We have to take responsibility, but I see this as a opportunity for us as a community to come together, for us to compromise, and for us to have a little bit of wiggle room to start off the school year. I hope this lasts. I hope we go backwards. To see the numbers that were posted last night, and to see that Hampstead had 11 new cases over the weekend, just over the weekend, that's concerning 2 weeks before school starts. And if that trend continues, the decision that we make tonight might be a moot point, and we may have to go to a mandate mask. And that's the last thing that I want to do. I would like, at this point in time, I would like to see at least the compromise, where if we're sitting at our desks, if our students are sitting at a desk by themselves 3 feet away, that they have the option to wear a mask. I would like to see that and start there. What's that?
Option not to wear a mask.
Option not to wear, or to wear a mask.
Yeah, I get you.
One of my kids said flat out that if they're at their desk, they want to wear a mask. And I support that. And one of the other kids said that if they're sitting at their desk, they'd rather not.
Right.
I'm going to support that. But we have to take responsibility as parents to not let this get out of control and to not let our personal pride or our beliefs of allergies, we're not all doctors, to affect this.
Well, and yeah, that does get hard because I think, any working parent can admit or should admit that they've, maybe sent their kid to school saying, well, I just have this meeting at 10. So just, go to the nurse, I'll pick you up right out, take some Advil, whatever. So we do have to, if we're going to do something like this, I think we have to be very vigilant with that. And I think it's a decent compromise for safety and choice. I think it would give the students opportunity to see facial expressions and hear their teacher and just, sort of be around their peers without that if they choose to do so. I think that if that's something that we choose to do, that we're going to have to put something in place to say, if we do this and this happens, we're going to masks. Because I don't think anybody wants to go remote again. I don't even think that should be an option. And so I would want to make sure that we can do whatever we have to do to make sure that doesn't happen, because these kids cannot lose any more learning. They just can't. It's just not. People say, oh, all the kids are behind, but that's not true. Not all the kids were remote the whole time. Not all the kids, had the same experience in school. So I think we did the best we could, but I don't want to see that. I don't want to see that again. So I think if we're going to do, if this is what the board wants to do, which again I do think is a decent compromise, I just think we need to make sure that we have that, whatever that number is. And I understand, Bob, that that's kind of what this is for you. So we would have to, that might be another discussion of how do we figure that out and how do we make sure that the community knows that too, so that they are not, there's no surprise if we have to say, we have to pivot a little bit.
So what I've heard being proposed, or at least one of the options being proposed, with the 3 feet of spacing, a student could take their mask off. I would consider that, if you look at our matrix, I would almost consider that to be a targeted approach, right? So the board may want to give some consideration where you see substantial, where you see universal under substantial for community transmission, make that targeted as well. We could redesign the matrix to make where you see universal up at the top, you could make that targeted, which would maintain the rest of the matrix. So to the point that we still have a standard by which we would determine when we would move from optional or targeted to universal or to optional. So just throwing that out there.
And targeted earlier, you stated, was if it's over 50 per 100K and over 5% positive rate?
That's moderate. So if you that is if you're looking at the top of the matrix, minimal is 50 or less average cases per 100,000. Moderate is 100 or more, and then substantial is anything over 150. So what I would suggest is just give some consideration. If you see the universal listed under substantial, you could change that to a targeted mask approach, which would constitute the 3-foot rule that you're considering. If that makes sense.
Yep, makes sense to me.
Because I think it's really important. We need to have a standard, right?
Right.
And whether it's deviation from the Department of Health and Human Services, but at least this way parents know we've reached this number of cases. I can go on the dashboard and see that. We know that a decision is coming by the school soon that we're going to move from optional to mandatory or mandatory to optional.
And then I guess at that point, it would just be how we communicate that. And I know that parents would know, but not everybody's going to be looking at this chart, and not every parent is going to be looking at every number. So communicating that out, we got to figure out a plan for that so that parents know.
Yeah, I would agree.
Can you remind me, multiple clusters, is that 2 or more, or is there, just want to make sure what on that third row down?
Based upon what I understand from last year, multiple clusters was defined as 3 or more.
Okay.
But that was last year, and I can certainly get clarification on whether they're defining that as 3 or more.
I have a question or a comment. I guess it's both. So I'm the conversation about the 3 feet while seated, taking a mask off. I'm getting there. My concern is coming about how we're discussing this, or how we're discussing our parameters, because if we have even higher, substantial, significant community spread, we may have a lot of cases that exist within the school that may not necessarily be clusters. So a cluster has to be related. We could have, I mean, what happens if we have 10 kids in a grade who are testing positive for COVID? They're not technically a cluster because they're not getting them from each other. I just want, along the lines of having clear guidelines. That's my only concern. We may never get to that point. I'm not saying that, I'm not assuming that we're going to have 50 cases within the school. Please, God, no. But that's where and I don't know if that means that we need to work on this a little bit more. I do think we should make a decision tonight. I don't want to put it off because I don't think that's fair to anyone. But just in how we're defining this, I don't know if that maybe means numbers of cases within the schools rather than defining it as a cluster. I think the cluster thing gets hard to figure out sometimes. But so I guess it's not so much a question, but maybe just a comment.
Maybe the wording even of how that is, it's like amount of cases in the school or cluster.
Yeah, I don't know. And I want to keep it straightforward for everyone. I just want to make sure we're covering where we're trying to be clear for everyone about when we make changes. I don't want to tie our hands should we get to the worst case scenario where we have a lot of cases that maybe are not necessarily interconnected through the school. Because we could also have a cluster that comes from somewhere else.
Right.
That's affecting our school, but it's not, I don't know.
If we're looking at the numbers, just because right now there's 17 in Hampstead, that doesn't mean that any of those numbers are school-related in any capacity. They might not be, someone with a kid. It might not be a child. It might not be a student. It could be a single bald bearded man at home by himself. It could. We don't know that. I know there's a lot of guidelines and laws that say you can ask certain questions and can't ask certain questions. Do parents have to inform the school prior to the school year starting if their child has it? Like if it's 2 days before or 3 days before, should they be contacting the school? Is that something that they shouldn't be doing?
So an approved, when a parent seeks a COVID-19 test for their child, it's usually done through an approved medical provider, Convenient MD, Walgreens, CVS. They are obligated to report that data to the Department of Health and Human Services, who would in turn have the parent report to the school, but DHHS will report that. Now, and it's not perfect, but the Department of Health and Human Services would report that to the school. And they would require, the Department of Health and Human Services would require that quarantining. Now, what can make this a little murky is now we have home COVID tests where a parent could test their child for COVID at home. Again, it's not a PCR test. And they could not report those results, and that child could return to the school setting and the school wouldn't know.
Where school's currently out, when would DHHS start reporting to the school saying, hey, we just received this positive test? Would that happen during the summer months?
It does not happen during the summer months. And again, That is, there are times of the year where Health and Human Services can be inundated, and the reporting of that information can be slow. So they really ask for parents to self-report to the school. So it's not a perfect system, and they have not reported any student cases to us over the summer months.
So to the best of our knowledge right now, be very clear about that, we don't have any cases for students that we know of at this time.
I do
of our
not know of
knowledge.
any students now.
Okay.
The expectation is that it's the schools that are actually reporting to DHHS, and that's usually how it works.
Are you referencing like I think it's 80 students that have been here? Is that what you're kind of leaning towards? Or?
No, just, we have students that may have it right now.
Gotcha. Okay.
There may be students in the community that have already tested positive, and I'm just curious if that has been reported to the schools at all, if that's something that DHHS has done over the summer. That's all.
Yep. Questions, comments, anything else on this?
I think I've asked all I got.
Megan? All right. Any other options on the table? I mean, really, it's anything else that we want to talk as a variation of this?
I'm okay with this and talking about putting it to a vote with the other pieces that we're talking about having in place. I know the PCR testing is optional. I hope people will take advantage of that program, because I think the more layers we have, the sooner we get to a point that our cases are lower, which is what we all want. We all want the cases to be lower so that we can clearly step down or whatever.
All right. Does anybody want to make a motion?
Before we do, I think, how do we want to deal with the question you had about that, I don't know, like the number or the wording,
Like if we get to a situation that has to be mandatory?
Yeah,
or
but
something
even
that?
like what Bob was saying about potentially like modifying that chart a little bit. I mean, do we want to, like, whatever motion we make, like sort of put that in there that we would need to make that modification?
I think it's a good idea. We heard someone even tonight speak that last year there wasn't a lot of transparency. We never knew where that line was, and to have that line there and to have a number that parents can see and identify with, because to Bob's point as well, Mr. Thompson's point as well.
You can call me Bob,
it'd be good to know for parents who are looking and for parents who are keeping up to date, it would be good for them to be able to know the night before, hey, we just hit this number, we just hit this level, tomorrow we have to wear masks.
Right. So we need to. I guess part of my question is like, when are we going to modify that to be able to show?
So I guess, Mr. Thompson, would you have a recommendation here?
Yeah, my recommendation, in fact, I'm going to stand up, I just want to look at the chart. So if looking at this chart, right now we have, can you put this? This is the issue we're facing right here. School has not started. Oh, that's okay. School has not started, but we are at a level of community transmission that is at substantial. This chart indicates that we are universal. Now, I would define these three categories. Optional is optional. There's no expectation that a child's required to wear a mask. Targeted, based upon the conversation that I've heard here, is the 3-foot rule. When you are sitting at your desk, you are allowed to take your mask off if you are spaced at 3 feet. And then universal is everyone's wearing masks, we're wearing them all the time. If the board is considering making a motion and deliberating on opening with a targeted approach, perhaps the board would consider taking that top square that where the pointer is and changing that from universal to targeted. All of the other parameters remain in place. So what that would mean is if we start school, now we have that other end of the matrix that we now take into consideration. If we have sporadic cases, we're optional. We have a single cluster, we're targeted. But if we have multiple clusters, again, defined right now, it says three or more equals a cluster, we would move to universal. So essentially that top square over there moves from universal to targeted. And Nicole, can you go to the next? And again, these get maintained. So when folks are like, when are we moving in and out of a specific criteria, we can say green is the 50 cases or less, the red is 50, and then the red is anything over 100. So we maintain specific data that moves us in and out of each one of those. Just a recommendation. And can you go back to the previous?
I'm good with that.
And I would say that we're going to talk about this at every board meeting. We're going to be talking about this ad nauseum. I'm sure we're all going to talk about this tomorrow. We're going to get feedback. We have a school board meeting on the 14th. So 1 week after we start, I'm sure this will be a topic of discussion. How are we doing? What's going on? But I think, we did have members say, what's the number? What's the target? I've saved my opinion on what I think about, a lot of this, but I think this gives that middle ground for everybody. I think that there's going to be people that don't like it no matter what. I think there's people going to like it no matter what. So I think that's my opinion on it. It gets a middle ground for us, and I feel it still keeps us safe with all the different things we've been doing and are continuing to do, and more that we didn't do last year. So that's my take.
So if we take your recommendation to change that upper right-hand box to targeted, based on that, we would be starting the school year with masks required in offices, small groups, hallways, areas where we cannot maintain 3 feet of distance. And we would be saying that masks are optional if you're sitting at your desk, if you're 3 feet away from everybody else. Correct?
That is correct.
And based on that, if our case count in Hampstead goes down in the next 2 weeks, we still have 2 weeks before school. That may even go back down into the green, and we could be looking at just straight up optional.
Yes. Now, looking at the 14, because it is a 14-day average, I do not expect, I would love for this to happen. I don't expect us to move by September 7th to the moderate category. That would be great if we could. But yeah, that's an important point, because, we could, a lot could happen, and we could be moving in and out of these various stages. And we're saying right now we're doing the 3-foot rule. However, circumstances improve, and we're not. We're at optional. But we just need to make sure we're communicating that to parents.
And on that same vein, it could be that if we go by this model, doing what we're talking about, in 2 weeks, if that number gets to what we're saying there, we could end up with masks. So we have to, if we're going to go by this, we got to go by this, and that's what everybody needs to look at.
Exactly. If we were to have multiple, based upon this standard, if adopted, if we had multiple clusters within the school setting and we're still in that substantial category, if we have multiple clusters, we're mask mandatory. But at least we have data we can provide to individuals so they can understand why we're there.
I'll make the motion, but I got to figure out how to word it.
Yeah, I think we have to do this carefully.
So where my mind is going is I would like to make a motion to use the chart that has been provided to us by the DHHS with the edit of the top right-hand corner changing from universal to targeted, and that we start off our school year with the, I guess, targeted platform that states in small spaces where 3 feet distance cannot be achieved, we wear masks, and sitting at our desk 3 feet away from other students, we have an option.
And outside.
And outside. And I think outside was pretty much universal, that it was going to be optional no matter what. But we can add that to the motion if we need to, that outside masks will be optional.
I have a suggestion on wording. So, what you just said, and can we define within your motion targeted to be masks required except in the instance of seated at a desk 3 feet apart? I'm trying to make the motion simpler.
You also get the cafeteria
Oh,
and gym.
are we not having them wear masks in gym? If they can't be 3 feet, oh, I guess if they're 3 feet apart, if they're playing, okay, I tried to make it simpler, I failed. I mean, I think a targeted definition is good, but, yeah, what are we doing in the cafeteria?
So we are able to maintain 3 feet of distancing in the cafeteria.
Okay, so.
And if we need to make modifications again, if, class sizes go up, we can certainly do that. We can get creative.
So what if the targeted definition is instead of,
Right, I know where you're going. Good.
Target definition could be 3 feet of spacing.
yeah,
And we can develop, working with building administration, guidelines to share with classroom teachers about what specifically that would look like. And I do think it would be helpful in the motion if the motion was made to accept the Hampstead roadmap for a safe return to school with a modification to the matrix. Because that way you're approving the entire plan, knowing that the one piece that you are modifying is the matrix to replace substantial under or universal under the substantial category to targeted. And then what we can do when we finalize this plan, because it's still a draft, we can come up with definitions for each of those three, for universal, optional, and targeted, to include the definition proposed by the board that 3 feet of spacing would fall under the targeted category. That makes sense?
Yep.
I feel bad for Melissa.
What's that?
So if I can make a suggestion,
Go ahead, Melissa, please.
I'm formulating a motion per the discussion. So if I can finish doing that, I could read it back the way that I'm interpreting it.
Yep.
And if someone wants to move that motion forward, they could go ahead. So I'm almost there, but I think I'm going to finish what I'm typing first, and then I'll need the board to define targeted for me so I can get that down.
Okay.
Okay?
Thank you, Melissa.
I'm ready for the board to define targeted, please.
I think targeted is where students can be 3 feet or more, masks are optional. Straightforward?
You say that again?
Where students and staff can be 3 feet or more, separated 3 feet or more, is targeted.
Are we talking about outside for masks to be optional? Are we putting that in the motion too?
I think that's in the plan.
That's already in the plan, so
Okay.
this would be outside of the recommendation. So the motion would be to adopt the plan,
Yep.
except when students and staff can be 3 feet or more.
So this is what I have. Is the board ready for me to read it?
Please.
Okay.
Thank you.
To accept the Hampstead School District roadmap for a safe return to school and use the chart provided to us by the DDHS with the edit of the top right corner from universal to targeted, and we start off our school year with the targeted platform with targeted to mean where students and staff can be 3 feet or more.
So I think the only question or concern that I would have with that is if rates increase. If we're stating that we're starting at targeted, that's what we're saying tonight based on tonight's numbers. But if the numbers go down, we may be optional. If the numbers go up, we may be forced to be universal.
But do you think that this needs to define more, like masks in hallways, and like, do we have to define that more, or is this okay the way it is? I'm just with the.
Well, what if we, oh, sorry, David.
Yeah, I don't think so. I think that with this, it allows, we know that in the hallways, the students cannot be 3 feet or more. We know that if two students, there's going to be too many times that students are next to each other, passing by each other, eliminates that, it's 3 feet or more. I think that's giving that guidance. I don't know, Mr. Thompson.
Yeah, because I kind of want to make sure that it's like sort of like seated at their desks, and so
What if we said required except with 3 feet, like in the targeted definition, masks required except for when 3 feet or more distance? Because we're not actually saying in masks, like we don't say in that targeted definition.
because it's really only optional in class or if you're eating lunch.
Or in the gym.
In gym.
Or.
But it's also gym if you're like playing something you can be spaced out. If they're playing
Right.
basketball, they might have to wear masks. Although if they're outside, I don't. We're trying to.
I
cover
know.
every
I know.
single
I
thing.
just. I just want to try to make it
Say,
as clear as possible.
When
is all.
3 feet of physical distancing is possible, students may remove their masks or face coverings.
Yeah.
And again, the administrative team, we can develop the criteria for what that looks like.
Right.
Obviously, it's 3 feet within the instructional space. We can achieve that also in the cafeteria. It might even be school-specific, but at least if we could develop that criteria and communicate that to parents.
Yep. We're good?
I read it over?
You want to read that over, please? Thank you, Melissa.
And I apologize in advance if I'm not getting this correct.
No, it's good. Thank you.
To accept the Hsdsb School District roadmap for a safe return to school and use the chart provided to us by DDHS with the edit of the top right corner from universal to targeted. And we start off our school year with the targeted platform, with targeted to mean where students and staff can be 3 feet or more to remove their mask.
Yep. Comfortable?
I think it's DHHS.
Yep.
I think you may have said DD.
Sorry?
Oh. I think you may have read DDHS.
I think I did.
Oh, okay. DHHS.
Thank you.
So that motion is from you, Jason? Do we have a second?
Second.
Further discussion?
I think everything I want to say I've already said, but it's a compromise. It's a start. And it might last a day. It might last the whole year. It might get better. We're a community. We talk about how great this community is. We see it online so many times. In a situation like this, as a community, we need to work together. We need to do this together if we're going to keep this or if we're going to get better at this. So just in advance, thank you to all the parents who are doing the right thing. And then obviously, thank you to the administrators for developing this plan, listening to the conversation, and working with us. It's a compromise I feel better about.
Yeah, I might just kind of just want to add, this has been like a very, very, very difficult thing to maneuver around. And I mean, I've been all over the place with this, and it's just been really hard. And I think this is a good compromise. I know that some people are not going to be happy. And I just appreciate you all coming out and talking and listening, and I hope that people can understand sort of where we're coming from and that we're really trying hard to be transparent and to sort of find some middle ground where we can all, meet on. And keep the kids safe and in school is, of course, the most important.
Yeah, and just thank you. Pretty much, I'm just going to give a thank you to the administration, fellow board members. I know there's a lot of time and energy going into this that is often overlooked. Besides being there for our children to, give them the best education, we're thrown into this. I don't think anybody would have thought, ever that we'd be thrown into something like this. So appreciate the guidance, the thoughtfulness, the direction, the disagreements. I can tell you that there's been disagreements, but it's been respectful. It's been good discussion to come to what is the middle ground that's best for everybody, but also not the best for everybody. That's all. So
They largely are the county numbers. They're not the Hampstead numbers or the state of New Hampshire. So it's, yeah, off of Rockingham County. Yep.
So,
Yep. You're going to take a DHS recommendation and alter it to lower, increase your liability insurance, please.
right. So we got a second. I think it's ready for a vote. All right. All approved motion? Raise your hand. All right. Thank you. All right. Went on for a bit. We still have a lot more to get through tonight. So next, we will talk about strategic plan update, Mr. Thompson.
Yes. So I'll keep it brief. So we have begun the process of finalizing the committee, the steering committee for the strategic plan. We put out a call to our parents and community members, have approximately 15 individuals who have volunteered to serve on a focus group, and we're in the process of selecting a community and a parent member to serve on the steering committee. We are waiting for staff to come back next week, and then we'll start soliciting volunteers, staff members to be on the steering committee as well. Our first meeting is scheduled for September 27th. There'll be an organizational meeting, and it is our intention to wrap up the work and present a completed plan to this board at the January 25th school board meeting.
Thank you. All right. Let's talk. So next, Ms. Thompson, you're right up again. There's discussion around kindergarten and the central school.
Yeah, so I just wanted to put it on the board's radar and the community's radar that, we're running 4 sections of kindergarten. We're fully subscribed, so there's really no additional space in those classrooms. And I want to put this on the radar just because in early July, when we began the process of processing registrations, we actually had 18 additional registrations, which would have necessitated the need for either holding a lottery and having 18 individuals who wanted full-day kindergarten to not be able to have full-day kindergarten, or adding an additional section. So I worked with Dr. Cheney to come up with a proposal that would have added an additional section of kindergarten. It wasn't pretty, and it wasn't pretty because we don't have space in that building. And we were able to come up with a plan that would have displaced some of our current programming in order to add a kindergarten classroom. However, that plan has changed. When registrations began, we had some parents that indicated to us that they weren't going to enroll their child into kindergarten for a variety of reasons. One of the leading reasons was we have families that are going to defer a year because they don't want their child to start public school in a pandemic. So I think this is important to put on the board's radar because these 18 students that will not be joining us for kindergarten are likely to join us for first grade. That's going to impact our first grade numbers. So you'll see that in the fall when we present our operating budget, we are going to budget for an additional first grade position, knowing that these students will likely join us for first grade. But it also just highlights the space issues. If we have a scenario where we're adding a grade 1 section next year because of the numbers, and we also discover that we have increased numbers in kindergarten, I'm not confident that I know where we're going to add 2 additional sections. It's something that needs to be on the board's radar. Dr. Cheney and I have walked the spaces to look at where we could possibly relocate programs. But, we are seeing increased enrollments If it doesn't impact us this year, we're off the hook, but it will in future years, and we're not sure where we're going to be able to house these students.
Yeah, I think for myself, in talking to you ahead of this meeting about this, there are options that you and Dr. Cheney had talked about that I think would negatively impact the education of our students. We've talked, is it art on a cart, right? Not what we want. Is it taking away our ventures program or putting them in a smaller room, sharing with student services, sharing with, it's really putting kids really, really close together, and it's putting, taking away the education we want to give to our students. It's been here, and we've been saying it for years, that it's upon us. And I do fear that next year our kindergarten goes up again. We need 5 kindergarten classrooms. We need 5 first grades. We need 5, we're running out of this. We've got not a lot of time. So, yeah. All right. Speaking of Central School, Mr. Dowd is going to talk a little bit about the 60s wing improvement project.
Thank you. Thank you very much. Can everyone hear me okay? Excellent. So overall, things are going okay on the project. Obviously, we've been on an aggressive time frame since this was approved in March. We've had a few obstacles which were not unexpected. We thought we'd run into some obstacles, and that's okay. So our HVAC units are behind, as are most HVAC units for most buildings in the region, and a few of our windows have been back ordered as well. So we're going to have temporary heat and air conditioning solutions in those rooms in the 60s wings built in, and they'll be removed when the permanent HVAC is installed. Anything left to be installed for windows and HVAC will be installed in one, if you will, one interruption of the class. The class will be, if we cannot accommodate it at night or on the weekend, the class would be expected to relocate for not more than a few days and have all of the work completed at once. So after some structural reinforcement outside, our brickwork has begun, which is very exciting. Brickwork was never anticipated to be completed at the commencement of school. So that was always something that was going to run and be completed after school had already started. I've been assured that work that'll be going on when school is in session will not be disruptive to the learning environments. We've made that a priority. We have a meeting with our building contractors and general contractor and builder architect every week. That's been an ongoing theme. So we're also going to have another change at Central School, which is that the drop-off loop will no longer be in the back in order to allow our construction teams to work in uninterfered with manner. Cars will be queued up on the front sidewalk, which is parallel to Emerson Ave. That'll be the drop-off and pickup area. There's a sidewalk right in that drive that you would normally use to exit the property. So parents should be on the lookout for instructions on that from Dr. Cheney as we approach the beginning of the year. Parent open house was scheduled for September 1st for Central School, and that is on track.
No, that's great.
Any questions?
No, I think walking through that this evening with you and the administration was great to see. A lot of work to do, but it's great to see it's finally happening for the kids in that 60s wing that's been on our docket for many, many years. So thank you for everybody participating. Again, thank you to the town for voting for it. A lot of great work being done. So thank you.
Thank you.
Next one is on superintendent evaluation. Just wanted to speak a little bit about this, about what we've done over the summer. So we had a number of working meetings over the summer as a board and with Mr. Thompson to revise our superintendent evaluation so that, my opinion on this, it's more centric on what we expect of the superintendent, but also having our students' education first. So we've revised quite a bit of this to a point that we're good with where the board believes we should be evaluating the superintendent. We now have, and I don't know if we need to put a vote to this or this is just by consensus, but we're going to be asking superintendent to work with his direct reports to revise the 360 eval from his direct reports based on what we've provided input, and look to have that done by the end of September, so that come the first meeting in October, we'll be able to review and vote on a new policy, CBI-R, for the superintendent eval, So, Mr. Thompson, I don't know if you heard all of that, but just the direction we've talked about in the past where, but, work with your directs and by the end of September have this completed from the 360 eval for the board to review ahead of the next board meeting, the first board meeting in October.
Absolutely.
So I don't think we need a vote on that. I think that's just by consensus, just so. And again, thank you, Mr. Thompson, to bring your leadership and your experience, but also the board members for, number of hours we've dedicated over the summer on this. So appreciate that.
Question
yes.
on that. Did we ever define the scale, the rating scale?
Yes, we did. Oh, that's a good point. We defined it, we wanted it 1 to 6, but we did not define the, the words behind 1 to 6.
Okay.
So I'd say over the next month, that's something we should work on. And I don't know if maybe the members of the policy committee would want to take that.
Sure, we can bring that to the policy committee. She's not here. Where'd she go? Thanks. Let her know that we'd like that on policy committee. Yes, policy committee can define the 1 through 6.
Okay.
Yep, we'll take that.
I also believe one thing we did not put on this yet, but we want to, is to revise the timing. I think we did agree to that the timing would be more in line with the school board rotation versus the school year rotation. So that's one thing we'll want, maybe if you wouldn't mind also taking the lead on that.
Yep.
Okay. Just so that everybody knows that currently our evaluation for the superintendent is due in June, when we may have new board members, so it's kind of unfair of new board members, also unfair to the superintendent for new people to evaluate how the superintendent's doing. So we're going to be moving the dates, shifting it so that the evaluation is done before school board members leave and before there's new school board members, which is typically in the March timeframe. So that's what I'm talking about with changing the timing of when we do the superintendent evaluation. I think it would be more applicable and more data-driven that way. And we've all agreed to that as well, but I don't think we put that on the cover page yet. All right. Let's see. Next one is school board goals. This is another one that we worked on over the summer. Again, this was one that we wanted to make sure that we worked on and agreed to before the school year starts, because again, in past years, there's been times that we're not completing the school board goals until later after the students start. So this work we've done is to get us to have this agreed upon by the first day. So I'm going to read through these so that it is, again, transparent and inclusive of the community. And also, if anybody wants to speak up anything that we've decided. But we've come to terms with about 8 school board goals that we'll be working towards throughout the year. That is center to everything we'll be doing going forward. So this one I am going to read just so that everybody has it, and it's very clear to everyone that's watching or that will see this later on. So our school board goals: mission of Hampstead School District is to provide challenging educational experiences that prepare all students to succeed to their individual potential in a changing world. We have 8 goals. First goal: facility improvements. And this is no particular order. There's no priority here. These are just how we've listed these as we walk through it. But the first one, again, facility improvements. To continue educating the public about the inadequacies and the need to secure funding for renovation and improvement of the facilities in order to meet current state minimum standards for education and recommended safety requirements. This is one that goes back to what Mr. Thompson was talking about with Central School, is that we are seeing, and we knew forecasted numbers that in the coming years, and this was going to be the first year that we'd start to see constraints at the Central School. Luckily, we've done a really good job to educate and vote on the renovations. The next one that we'll be looking at in a future board meetings, what do we want to do about the balance that we've talked about in the years past, but this is what this is encompassing. Anything in addition? All right. Appreciation of diversity and inclusivity. To support a culture of acceptance, diversity, equality, and inclusivity by providing opportunities for professional development to staff that foster a variety of perspectives to ensure our schools are welcoming, respectful, and a safe learning environment. This is one that's been there, and it's a really good goal to have. Next one is strategic plan. We talked about this a moment ago with Mr. Thompson. To create, support, and implement a new 5-year strategic plan. So it's something we will be working on, and I believe the goal is come January, we'll have that in a draft form for the board review and discuss in further detail. Budget. to develop an executable 2022-2023 budget for the school district that supports a culture of continued improvement and focuses on student academic requirements in a fiscally responsible manner. Number 5, effective use of resources. To ensure effective utilization of federal, state, and local resources to address ongoing educational challenges related to the COVID-19 pandemic. This is related, again, a lot to the ESSER funding. We will be communicating more about how we plan on using it, and we've talked a number of times. We want to do that effectively. Any other comments on this? I'm going to keep going. All right, SAU 55 support. To provide for continuing support of the new SAU central office. Again, we're our own single SAU now, so this is something that we'll continue to support as we have already kicked that off, I'd say, and then we're well on our way. And just a pitch, if you've not seen the new SAU office, it is over by the library. It's well worth going in and having a conversation. Mr. Thompson and others of his administration are welcoming anyone to stop and talk face-to-face, offer to buy coffee or water or come to the school meeting or wherever you want, but any place, I think that's great, and that's what we want to continue to outline and support. Innovative practices. To support the implementation of innovative practices by staff to promote social, emotional, and physical well-being of all students in the district. Again, any input, anything in addition? All right. And lastly, one of the newer ones, and one that we've talked a number of times tonight, outdoor community-based learning. Explore opportunities to establish experiential, outdoor, community-based learning and evidence-based practices which foster resilience while building a sense of community and connection. So this is a newer goal that we'll be continuing to communicate and looking at ways to put this in place with our wonderful new administration. So thank you. All right. Any other things on the school board goals? We do need to take a vote. I almost missed it. So I'm looking for a motion to accept the school board goals for 2021-2022 school year.
So moved.
Can I get a second?
Second.
Conversation? All right, all approved, raise your hand. All right.
Thank you.
Thank you. ESSER fundings. So Nicole Tomaselli?
So I did put in your packets. I apologize it wasn't emailed to you a few days ago, but there's a page that looks a little bit like this. So ESSER is something you're going to hear us talking about quite a bit in the next few board meetings and over the next few years. ESSER stands, just for people at home who are still watching and in the audience here, it stands for the Elementary Secondary School Emergency Relief Grant money. This is money coming from the federal government into New Hampshire and then being disseminated out to towns. And the point of this money is to help districts safely reopen and sustain the safe operation of schools and address the impacts of the coronavirus pandemic on the students. So there are 3 rounds of ESSER, and I wanted to kind of put this in a chart for people who maybe aren't as familiar with the deadlines and the rounds. So ESSER 1 money came out last March. We have expended all of our ESSER 1 money. We purchased 182 Chromebooks at $275 each to be used during remote learning periods and hybrid learning, and that was a very successful implementation. So many thanks to Joe Dion and the IT team that really made that happen. In fiscal year 2021, we have ESSER 2 money that was released in March again, except we have till September 2023 to expend those funds. Now, the caveat with ESSER 2 says that 20% of your funding has to be spent to address learning loss. So we're going to do this in a few different ways, and we already have started. We had a vision for a summer learning academy, and I really cannot thank the principals enough. The teachers who have come in have been so committed. These have been some of the most beautiful weather days of the summer, and they're so committed. They're here, they're working with our kids, and you are sending us your kids, and they're having a great time. So we are very happy to make that vision come to life. So we're going to pay for that with ESSER 2. We're also going to be buying some curriculum products that will help us really do some targeted intervention work as well as assessment work. And some of those tools our teachers are already using, like Lexia. And then we also have some money that we're going to put towards educational technologies for the classroom and possibly to outfit this space here, which I'll talk about next. And then after-school enrichment opportunities. Like I said earlier, we're going to have a lot of room to grow our after-school homework club into a much more robust after-school enrichment series. ESSER 3, the money has not been released yet from the DOE. I just submitted our plan to them on Monday. We are I'm expecting to get close to 280,000. We will have 3 years to expend that money. Again, 20% has to be set aside to address learning loss. It's definitely my intention to spend far more than 20% on learning loss directly impacting our students and keeping that money in, close to home here with our teachers. And some of that, and I can explain in the next slides how that will look. But the main goal for me for now is to do program evaluations once the school year starts, really look closely at our practices, and then develop some continuous improvement models. So again, this is a very quick kind of snapshot of ESSER 2. And I wanted to put in here too that we can also utilize that money for some operational expenses. So for example, we could fund a custodial salary with that money if we agree to. Because ESSER 3 is a larger pot, I wanted to spell out some of the kind of ideas that we've been collaborating on. So we've talked about after-school enrichment. We've also talked about stipends for tutors to provide that continuity of instruction should a student test positive. We're going to stipend our certified teachers and paras using ESSER 3 money. We're going to work on our SEL and advisory programs and develop them. We're going to probably fund another Summer Learning Academy next year. Some of the curriculum tools that we're looking at have a 2- and 3-year agreement, so we may find that other products we want or change our mind as we go with that. And then also some professional development for innovative practices. Does anyone have any questions? That's all I have for ESSER.
No. I think it'd be great to, not tonight, but another night, I think we'll talk more about some of this, like, thinking forward, how can we support this more, just make sure the board is there and can speak more to it. Because I know I get a lot of questions about how we're helping with that learning loss, and I know we all do, so I think a little bit more detail in a future meeting would be good.
Sure. Yep.
Anyone, any other questions or comments? I mean, I can't say enough. I mean, I know my child is in the summer learning program, kicked and screamed before, but loves it now.
Oh, good.
Like, I can't tell you how many times I almost had to butter her up, but she and others that I've talked to, her friends, have said how much they're enjoying it. And for them to say again, on an August day where it's 75 degrees out, 80 degrees out, their friends are swimming, and they're actually enjoying it, I appreciate more than as a parent, but also as a community member that the value is there. We often ask, think about, is the value there? And I think this program has hit a home run.
Oh, thank you so much. And I want to make sure to express that, so the Summer Learning Academy ran for 8 days this summer. It's going to be wrapping up on Thursday. We've had 57 students at HCS and 23 students at the middle school participate. I wanted to also mention that we've partnered with Ryan Holder from Adventure Lore, so I want to thank Rob and Nathaniel who've been on site working directly with the kids, and the kids really respond well to them, and the staff are watching and modeling what they're learning. So that really, to me, is the best professional development, is bring the experts in, let them interact directly with the children, and our staff can see that work and then model it themselves. So that's working out really well. We also had the Brown Center for UNH come in to help do a kickoff early on in the year. They are a high demand organization right now that's may or may not be able to stay with us during the school year, but it's been wonderful to get to know them a little bit. And then also Mr. Jim over at Let Go Your Mind is doing the Lego robotics and coding program at the Central School that's very popular, and we're going to see if we can find ways to grow that in the future as well.
That's great.
I was able to come to the school, to the middle school today, and so I did see the interaction with Adventure Lore and the teachers, and the kids were having a blast, and they looked really happy and really like they were enjoying themselves. So it was nice to see.
In talking with some parents around busing and carpooling a few weeks before we started, one of the parents kind of said, I think I really can't wait to sign my kid up to shake the cobwebs off. I think that's what we're going for. And I thought that was such a good analogy. Like that really captures the spirit of the people who just kind of signed up and went for it. But I think it's really exceeding a lot of expectations in different ways.
Yep. Good. Thank you.
I have the
next one's right to you also,
Yeah.
the tech upgrade.
All right, so the tech update, I don't have a slideshow for this, but what I wanted to let you know is that, so apparently a previous administration has put a request together to update the technology in this space in the middle school. So I am taking this on and trying to make this happen as urgently as possible. The equipment and I feel so bad for the people at home because the video recording equipment and broadcasting equipment that we're using to live stream this meeting is 12 years past its life cycle. So we inherited it from the library in 2017 as hand-me-down equipment. So it's been back there. They are magicians back there making this all work, including all these cameras. I took some pictures, which I can happily share with the board. We have a Hsdsb video server back there that is current, that can handle high-def quality video and stream it out live and do it on demand if we want it to. The problem is that we have interface monitors and a controller that are not high-def, they're analog. And all the wiring and these cameras are analog. So we have the capacity to deal with high def, but we don't have the components to record it and to then transfer between the cameras and integrate a projection that is 16:9. Our current capture is 4:3, which is why things look blurry at home. So as I've learned about this in the past 2 weeks, I feel bad for the people at home who are struggling to keep current with the meetings. I am in the process of getting quotes. I know we have a school board policy DJE that tells us that if we go over 10,000, if it's between 10 and 20,000, we need to get 3 bids. If it's over a $30,000 quote, we need to put it out to bid on an RFP. I do have a quote. I know the previous administration had mentioned that we could piece this together for about $6,000. And I just want to say to you that after talking to 2 different AV companies, it's not recommended to piece it together because you have wiring and you have other components in that server that may not be able to handle that HD resolution. Okay. And also, if we're talking about replacing the components, we're paying on eBay an exorbitant amount because they're legacy vintage pieces now.
Got it.
You know what I mean?
Yep.
So I think we want to totally modernize this and make it so that we can handle screen-in capturing as well as a lot of zooming features and have multiple inputs. So the quotes that I've gotten so far, and I'm in the process of getting a 3rd quote, they're coming in, and I can share the information with the board if they want the details. But I did have a phone call with the Department of Ed, and we can qualify this under ESSER.
Okay.
As a COVID rationale. The piece I'm a little bit more interested in, the board meetings are fascinating. However, the instructional value of having a control room could grow an AV club. It could help us to record, broadcast, and stream all of our band, choral, theater performances. I just see a lot of potential for this space with student-led assemblies. We've talked a lot with the administrators about multi-age activities, having central school kids come up here and watch things, having our kids go down there. It would be really nice to be able to stream that even to our classrooms. You know, it's wonderful to stream it to people at home, but streaming for internal use could be a really valid use as well. So I see the educational value in having this type of space. I'm sure the people at home see the value in having it as a more modernized board streaming technology.
I'd also add that, we have community events here. Not, we have our derivatives that are here. We also have some of the Veterans Day assemblies here and others that the community would use, and I think it'd be a lot easier, better to then also be able to broadcast that live.
Yep.
Or have it, more clear, because right now, I feel bad for the people that are trying to look at the screen tonight and the past meetings, so I don't know if you're looking for the board to do a vote on waiving the policy, but I think you're still getting the three bids, so I think we're still within the policy, though, right?
Let me get the policy.
I think the important thing here is that if we're looking to receive federal funding for this, which we may be able to do, we have a separate bid policy that couldn't be waived by the board anyway.
Okay.
So I think we're just trying to make sure that we can make a request on the appropriate equipment and install to make sure that we have a solution that works to make our meetings as accessible to the public as we can.
Okay.
So
I was just curious because I know you brought up the policy, so I wasn't sure if you're looking for anything. So.
Yeah, I didn't realize ESSER had a different bidding criteria.
Yep.
So.
Okay.
True.
Great.
So I will continue to gather quotes and share information back with the board, and we can proceed with putting it under ESSER funding if that's what the wish of the board is.
Questions, comments, anybody?
I have a question. As you're getting the bids, are we looking at just for this room or having a mobile component? And I'm asking that because we've talked about being able to move them around. And for instance, band and choral stuff is usually in the gym. So I was just wondering if what you're looking at has a
So I could quote a mobile component. I have not been, because the town hall has a mobile component that they've graciously brought over to other events from what I've been told.
Oh. It's good to know.
Good to know.
All right. I guess my only question is, what is the estimated lead time and installation time?
I did ask from one vendor. I asked both of our vendors. I heard back from one, 6 to 8 weeks for the materials to come in, and they would schedule it as soon as the materials came in.
Okay. Thank you.
Yep.
All right. Next one is for the Vice Chair, Megan, to talk just a little bit about Pinkerton Building Committee update.
Sure. So Pinkerton has formed a construction planning committee. It includes representation from the Board of Trustees, as well as each sending district has a school board member that attends the meetings. We've had 2 so far, during which Dr. Powers brought us through the results of the internal audit that was recently performed as part of the master plan. And he talked us through the recommendation, or the remediation plan recommendation. So there's 2 areas of focus. The first is the social studies wing. So this houses social studies classrooms as well as the special education programs. And the other area is the Shepherd Building, which used to be the gymnasium, theater. I think it still has some classrooms. It has a cafeteria where the freshmen and sophomores have their lunch. So these were the 2 buildings that were rated as, poor condition as part of the internal audit, and they are the focus of the remediation. So that's the first part, and then the second part is in April of this year, NEASC did their visited Pinkerton for the accreditation visit, and they highlighted several deficiencies in the social studies wing related to health, safety, access, and equity issues. And the recommendation was to renovate or replace the building. The building is actually was not intended to be permanent, and it was built in the 70s, so it's been there for a while. Go through my notes. There was no discussion of costs. The only cost that was shared is that It's going to be an estimated $3.5 million to maintain the current status quo for the two buildings. So the proposal is to tear down the social studies wing and then add on to the Shepherd building. So the thought is that the space that the social studies wing occupied would be an additional parking lot. And then the addition for the Shepherd building would be where the Student Services Center would, special education, and then there would be a visitor center. Dr. Powers took us on a tour, and I thought of Central School, and there were a lot of similarities based on all the work that we had done last year, and just the process of, if a student is ill and needs to be sent home, the parent has to check in at the main office and then has to be escorted to a different building to pick up their child or their student at the nurses. So I just, there were a lot of things I was like, oh, just on a different scale. One thing that I questioned was if they're going to be tearing down the social studies wing, where are those social studies classes going to go? So this is something I'm not familiar with, the different learning models, but Dr. Powers had explained that they're more geared towards a collegiate model, and so it's basically a classroom on a cart, and this is the way they feel they can optimize space utilization. So they would be shifting classrooms around, and they feel comfortable that they would have the space needed to accommodate those social studies classes. So I mentioned there were no costs. They haven't gone out yet. They're going to develop the RFP, and we were given a time frame of October. So maybe for the October board meeting, I'll have another update. I think that's the highlights.
Good. Any questions for Megan on that? I think it was pretty solid. Thank you. All right. Look forward to October then. Next one is the summer hiring ratification. Mr. Thompson, you want to speak to that?
Absolutely. So you will find in your packet the summer personnel reports. As board members are aware, policy GCF allows, I'll actually read some of the language from the policy, from June 15th through September 1, when the school board is not meeting, one of its members, in this case it was Caitlin Parnell, is so designated, may act on personnel matters as presented during the summer months. Those recommendations will be ratified by a quorum of the full board at a subsequent meeting. This is that subsequent meeting. So what I'd just like to do is go through very quickly all of the items that took place over the summer. We'll start with our resignations. So professional staff resignations. We have Amanda Maza, who was the Hollis Central School special education teacher. Cheryl Craig, who was the Hampstead Central School technology. I said Hollis, I'm sorry. I can't. It's an adjustment. The Hampstead Central School technology integration teacher. And then Samantha Wallach, who was the HMS math teacher. We also have a number of nominations, beginning with one administrator. We welcome Peter Schmidt as the Hampstead Central School assistant principal. We also had a series of professional staff members who have joined us. We have Kayla Dustin, who will be the Hampstead Central School Elementary School Grade 4 teacher. Jennifer Fossey, who will be the Central School Elementary School Grade 2 teacher. Brittany Hewitt, who will be the HMS math teacher. Jacob Hudgkins, who will be the HMS music teacher. Nicole Vacarazer, who will be the new FLES teacher at 50%. And Blair Wortham, who will be the Central School Elementary School teacher for grade 4. And with that, I would entertain any questions that I might be able to answer. And then we'd be looking for action on the board to ratify the summer personnel report.
No questions, comments? I'll make the motion to ratify the summer hiring.
Second.
All approved? Right, unanimous.
Thank you.
All right, thank you, Caitlin and Mr. Thompson, to spearhead that over the summer. Next one, we're going to go through board comments correspondence. We'll start far left, Jason.
I'm all set.
I don't have anything.
The only one I know, I said it earlier, but I just want to again spent a couple hours with Mr. Mackey. A lot of value to that with going through the middle school. It was really great to hear again that there's nothing major at the middle school. I know that's a big concern and lots of discussion in the last year. Middle school is looking really good. Hats off to Mr. Mackey and his staff for what they've been doing, kept in house. I think that was a big highlight. Is Mr. Mackey was keeping a lot in house. He was looking at sustainable solutions, meaning things that would carry on for years, not something that we'd have to repeat maintenance every year. As well as something that he did, which was great to hear because I'm kind of a data geek like this, but he's got a spreadsheet now of every component, everything with a timeline of when it was changed out, and it's going to be difficult to maintain, he acknowledged, but it's great to know we could go to him and say, okay, what about this? And he's got it there. That's how detailed he is, so I just really appreciate that, and I can be a facility geek, so I appreciate him sharing a lot of information. Other than that, that's what I got.
I don't have anything additional.
No, I do want to thank the administration and everybody for kind of working through what is has been really tough decisions, and I've been lucky to work with a board that listens to each other and tries to come up with compromises and solutions. So I just, I appreciate that. And Jeff, thank you for taking us through the central school today. That was actually pretty cool to see. I kind of got lost. I didn't know where I was with the things being so different. But it was really nice to see the progress. So thank you for doing that. That's all I have.
That's good. All right, consent agenda. Mr. Thompson?
Well, under personnel report, we did cover the summer personnel reports. I just want to make a plug. We do have some open positions. Like a lot of schools, we're, having a difficult time finding people who want to come to work in public schools. So I just wanted to highlight, we have a grade 6 math teacher position available at the middle school. We have a tech integrations position that we're still actively looking for at the central school. In student services, we're looking for a case manager and a BCBA position. But I also want to highlight as well, we have several paraeducator positions available, and I really want to make a plug for this for a couple of reasons. One, these are really critical positions because you work directly with students with disabilities. You have huge impact on kids. You help us maintain compliance. And for many of us, myself included, I started out as a paraeducator. Anyone who might be exploring a career in teaching, starting out as a paraeducator is a really great way to do it. You kind of dip your toe in the pool. So it doesn't require experience in education. And so I would highly encourage you, if this is something you're even thinking about exploring, to reach out to Tracy Griffin-Hagen or myself, because there's a number of paraeducator positions available, and we're concerned about that as we start the school year. And that's really it under personnel report.
Okay. Any questions on? And if anyone's interested, can you tell them where to go for? But,
Yep. So you can go to our website under Human Resources, and there's a link to AppleTrack that will allow you to apply. Also, positions are available if you look at EdJobs NH. Positions are available there, and also SchoolSpring is another popular site that schools can use. And I would just ask that they can reach out to any of the building administrators as well.
All right. Thank you, Ms. Thompson. Anything in the superintendent's report?
Yeah, so it's been a busy summer, especially since the last time that we met. So I just want to highlight a couple of items. First of all, on August 9th, we held an open house at our new SAU. It was great to have community members and families show up for that. I do want to just continue to extend that invitation for those of you listening at home, particularly community members who maybe don't have students in the school. This is your SAU office. So please reach out to any of us at the SAU to set up a time to come in. We'd love to take you on the grand tour. It takes all of about 2 minutes. But it's just an opportunity to interface, for you to understand where we're located, what we have to offer, and really what our function is. I think sometimes people don't always know what an SAU office does. I love the opportunity to be able to give them a little bit of insight. On August 11th and 12th, we held our leadership retreat. That is with all of our administrators, our assistant principals, our directors, our chief financial officer. And we held that at Pinkerton Academy. They were gracious enough to lend us their Astro Cafe space at no charge, which was wonderful. And that was 2 days of team building. It was an opportunity for us to do some professional development. We received training in human resources, in observation and evaluation. It was really, the highlight, I think, of that experience was teachers from the district coming to provide us newbies with professional development in several of the, one initiative in particular, that's the Universal Design for Learning, which you will hear more about as the year goes on. But really, to see the teachers' passion for UDL, to have them come here, present to us, and to share their vision of where they see this work going, it was just, it was really powerful, and I just can't say enough. I also wanted to highlight that we held a vaccination clinic on August 23rd. We had 18 individuals that participated in the vaccination clinic, again, completely optional. We will have a follow-up clinic in early September so that individuals can receive the second shot of the Pfizer vaccine. I've also, in negotiations, so to speak, with the Department of Health and Human Services for the purposes of hosting an on-site clinic when emergency youth authorization is given to the 5 through 12 age group. So to provide parents who desire to have their children vaccinated an option to possibly do that on-site. So that is in the works. And then also I'd like to take an opportunity to make parents aware, and we'll send something out in a communication later this week, that school lunches again this year will be free of charge. So there will be no cost for the lunches, similar to what we had last year. We will send out additional information in an upcoming communication to parents. And then lastly, because I'm going to turn over to Mrs. Denola in a moment, I want to extend my gratitude, as Nicole indicated, to all of the staff that participated in the Summer Learning Academy. The feedback that we've gotten, it was a tremendous experience. And in addition to thanking Nicole, I really have to thank, Mrs. Denola and Dr. Cheney. August is a very busy time for building administrators. We are starting a brand new school year, developing master schedules, making sure the building is ready. We are in the midst of a pandemic and planning for that. August is crazy. And the fact that under their leadership, they were able to pull off not only to get kids in the building for a program, but offer a program that we've gotten some really great feedback on. I really appreciate the work that they've done. And we look forward to the planning of Summer Learning Academy for next school year as well. That's a subtle hint. And with that said, I want to conclude the superintendent report with a brief report out from Mrs. Denola.
Thank you. We had a wonderful opportunity to have our cross-country track improved by an HMS alumni and cross-country runner, Mr. Ryan Lemoyne. He graduated in 2017, and part of his Eagle Scout project was to grace our cross-country track with these wonderful markers, the color of Mr. Giard's shirt. He did a wonderful job of that, and he came in and he shared some pictures with me, and I shared them with you as well. And one of the reasons he wanted to do his Eagle Scout project on this was that when he first joined the cross-country team, he got lost. And he didn't know where he was in the woods, and so that stuck with him forever. And so he came back, made HMS a better place, and so the markers are out there, and many of our alumni from HMS were there helping him. And a thank you to Mr. Blaska as his Boy Scout leader in this quest. And he had $113.77 left over from the donations he received for this project, and he donated it to HMS and the athletic department, especially for the cross country team. So what a sweet boy. I would have invited him here so you could give him a round of applause, but he is at Virginia Tech, and he started last week, and he is studying meteorology. So thank you, Ryan. We truly appreciate that.
Yeah, thank you, Ryan, and thank you, Mr. Blaska, for your leadership. That's great to hear. Thank you, Mr. Nola. Ms. Thompson, anything else?
That's going to do it.
All right. Well, you keep coming back after being hired, so, going into the almost the 60-day mark, so appreciate your leadership as well as this turbulent year. So I do not believe we have any other old business.
No.
I think this is one of the first times we do not have to go to non-public in a while, so that's appreciated. So thank you there. So we will look to adjourn. Can we get a motion that?
No, you can just adjourn.
I've seen it both.
Okay. Let's get a motion. I'll make the motion to adjourn. Get a second. If anybody puts their hand down. No. All approved? All right.
Thank you.
Thank you all very much for a very productive meeting.